the public who are joining us, you are more than welcome, and thank members of the public for joining us today. Can I please remind members that this meeting will be streamed live, and it would be helpful for you to put your microphone on mute. This will allow us to go smoothly with the meeting. Thank you. I have agreed to the inclusion of a late item of business, a report updating members on the current position regarding the coronavirus pandemic. I thank those members who have nominated third sector's organization and individual within their wards to my thank you event that I will be hosting on Zoom over the few weeks. We have had a brilliant response with over 100 organizations have already nominated. I am delighted to have the opportunity to recognize the work that has been done within our community in response to the COVID-19 pandemic. If you have not yet submit your nominees, I will give you until this weekend. Can you please submit who haven't submitted any nominees as yet? You'll have up to the end of this week to submit your nominees. Our office are very busy sorting this out. Can I also point out the individual that I will be recognizing? I'll be recognizing those third sectors and the individuals who have gone the 100 miles to support their vulnerable in their communities during the pandemic season. I won't acknowledge any groups that connected to protests or campaign. I'm only acknowledging third sectors and those that go the extra mile for their community. I would like now to extend congratulations to the following recipients who was honored in the Queen belated birthday honors list. First, we've got Linda Pollard, who has been awarded the Dame Commander of the Order of the Empire for services to healthcare and community in Northern England. CBEs have been awarded to Mr. Richards Davis Flint, Mr. Robert Sample, and Mr. Robert Webster. OBEs have been awarded to Jonathan Bates, Dr. Alison Jane Pettards, and Professor Sheen Radfords. Farah Khan has been awarded an MBE for service to children and family within Leeds City Council. Sorry, I'm just lost my paper here. British Empire medals have been awarded to Mr. Keith Daniels, Joan Swain, and Fazil Tubi. It is with sadness that I would like to announce that Lillian Black, who was also awarded an OBE for belated birthday honored for the service of Holocaust education, passed away at the end of October. Lillian's work was with Holocaust remembrance and education truly inspirational, and she has left
Lord Mayor, you appear to be muted.
We can't hear you, Lord Mayor.
Where did you add me to from? Sorry.
Just after Lillian Black.
Okay, thank you. Sorry. As we have not had the opportunity to pay our respect as usual at the War Memorial this morning, I hope you will all join me now in a minute's silence as we pause, reflect, and remember our brave service personnel who have lost their lives in time of conflict and to whom have we owed so much. Please stand, although you're at home, and join me in a minute's silence. Thank you. We'll now go to the minutes of the last meeting. Councillor Dawson.
I'd like to ask that the minutes be approved, Lord Mayor.
Councillor Cohen.
Second, my Lord Mayor.
And I'll call for a vote. I'll take all those silence as agreement. Thank you. Any declaration of interest? Councillor Peter Gruen, you have shown some interest. Could you highlight for me?
Lord Mayor, thank you very much indeed. Yes, I'd like to declare a direct interest in item 10 on the agenda. For members of the public who are listening in, and for the sake of transparency, I am the chair of the Gorse Academies Trust, and pupils of the Ruth Gorse Academy have brought to my attention safeguarding concerns that they have, which is why I'm declaring a direct interest. Thank you, Lord Mayor. I won't participate in the debate or vote. Thank you.
Thank you. Communication, Chief Whip, have you anything to communicate? Sorry, Chief Exec.
Thank you, Lord Mayor. You're promoting me then. I don't have any communications. Thank you.
Thank you. We've got the children mayors. First, I'd like to welcome Samuel Hill from Carman Schools, Community School to the council meeting. As you may have known, Samuel has been chosen to be the Leeds children mayor, and he's here with us today. I think Samuel is at school actually. So Samuel manifesto, he'll be reading his manifesto, and his manifesto is be yourself, love yourself, and respect all. Samuel, over to you.
If I was Children's Mayor of Leeds, I would work to get a theme of be yourself, love yourself, respect all others across all schools in the city. This would include a range of ideas which students can participate in to increase self-understanding, build better bonds with groups in schools, and increase knowledge and understanding of the biggest issues in our society. This will be delivered through an online resource pack that would include both self-learning and delivered learning to enable students to increase self-awareness, learn to be and love who they are, and from this learn to respect others for who they are. The online pack would include resources such as physical and mental well-being sessions, mindfulness classes, and video lessons on bigger issues from those involved in wider community issues. Each school will have a pupil and teacher ambassador who will ensure the programme is publicised within their school and also be a first point of contact for pupils that have any questions or need help in any of the programmes. Children learn self-loathing, to discriminate, or to be bullies. They are not born that way. We can teach them how not to be. My project will benefit all children in Leeds and in time have a major impact on the wider community, as these children will be brought up without the prejudices that cause many of major issues in our world. Lack of knowledge is arguably the root cause of issues such as bullying and racism, and these in turn are a major cause of mental well-being problems and low self-esteem. Providing the tools to ensure people respect themselves will then enable them to respect each other. Providing the learning around wider issues in society will provide the knowledge to allow children to understand these issues and learn tolerance towards each other. The portal would also include lessons on self-esteem and self-awareness, how to form relationships with others, exercise sessions such as yoga or PE. These would be predominantly self-taught, however, these would be good resources to be used in smaller coaching groups in school as these could be organised. While some content will be from outside specialists in the first instance, it's expected that the majority of material will be created and uploaded by schools, sharing their learning with all. The portal will be developed by students, minimising costs. The school ambassadors will encourage children to develop and deliver content that can be recorded and shared on the portal. A school may invite a local BAME celebrity, such as Nicola Adams, to talk about the challenges of being a black athlete. This would be recorded and form a library of resources on the portal that students can refer to at any time. As Children's Mayor, I will also be exposed to numerous local leaders and celebrities, and it will be part of my role to encourage these influences to contribute to the library.
Thank you, Samuel. Could you please unmute your mic and give Samuel a check? Thank you, Samuel, for taking the time out today to present your winning manifesto to the council. I know that the officers will be working with you throughout the year, and this will enjoy your stay. So please, are you going back to school, Samuel?
Yeah, thanks.
Yeah, please enjoy the rest of your afternoon. Thank you.
Thank you.
Producer and motion, Councillor Dawson,
I'd like to move in terms of the notice, Lord Mayor.
Councillor Cohen.
Second, my Lord Mayor.
May I call for a vote? Again, I'll take all silence as a yes. Thank you, it's been carried. Item 4, recommendation of general purpose, Councillor Dawson,
Move in terms of the notice, Lord Mayor.
Councillor Scope.
I second, my Lord Mayor.
Can I call for a vote? Again, I'll take your quiet first, yes. That's been carried. Reporting appointment, Councillor Dawson,
Once again, I'd like to move in terms of the notice, Lord Mayor.
Councillor Scope.
I second, my Lord Mayor.
I'll not call for a vote. Again, I'll take your silence as a yes. Thank you. We move to item 6, COVID-19 update, Councillor Blake. Councillor Blake.
Thank you, Lord Mayor. Just want to pause a moment and reflect on how difficult it is for all of us not to be able to conduct our business as usual. And I think today is a very pertinent day. Normally, we would have gathered around the cenotaph this morning, showing our respect. And I know we've all found ways to make sure that our messages of condolence and respect and remembrance have got out, but it does bring it home to us, I think, just how significant the impact of the COVID pandemic is. And of course, normally we would raise the rafters in the council chamber for Samuel coming to share with us his manifesto. And I think we can all be very proud of the way that he conducted himself today. And I hope we can send a message of congratulations to him through his school from all of us. Of course, we're in a very different position today than we were when we last spoke in council on COVID-19. We're just approaching the last end of the first week of 4 weeks of national lockdown and everything that means to all of us. I think all of us know our responsibilities in terms of our roles as leaders across the city, managing communication, expectation, and most of all, how we work together to protect our services, particularly to the most vulnerable. I have to be quite honest with you, it has been a very difficult time over the last few weeks, and certainly up to the period of the 31st of October, when along with fellow leaders from across West Yorkshire, we were in dialogue with government and members and leaders in particular in the last week or so of the period before the 31st of October, meeting with the Secretary of State for local government on a daily basis. We negotiated hard on behalf of our area, and I'm pleased to tell you that as a result of the discussions we had, we did come up with a financial arrangement that actually surpassed other areas. As we'd gone into Tier 2 on the 12th of October and we were eligible for financial support for our businesses, we managed to work with government so that going into Tier 3, we would keep that package of money. This was quite a breakthrough working with Treasury that would have brought benefit to everyone across the country and could well do so when we come out of lockdown. We sought continuous assurance during those negotiations that there was no prospect of the country going into a national lockdown. It was hugely disappointing when we got the deal through on the 31st and then found out through the media the next day and through the Prime Minister's press briefing on the Saturday that we were into a national lockdown. Leaks in the press is not the way to disseminate information from government, and I hope that will never be repeated. But I do want to pay tribute to all of the team, all of our partners and all of you for the calm and way that we dealt with that, the resilience we showed in communicating to the city that they weren't going to go into tier 3 and they would in fact be participating with the national lockdown. I hope you recognise that our approach is inclusive. We bring reports to Executive Board regularly, and we work particularly closely with our partners. And I'm pleased to be able to let you know that at the moment, numbers in Leeds are stabilising. There is no room for complacency though, Lord Mayor, and I hope we can continue with our one city approach, working with our partners and making sure that we continue to work constructively to manage the impact of the virus as it continues, and most importantly, to work together to help to deliver the vaccine when it finally comes our way. Thank you very much, Lord Mayor.
Councillor Charwood.
Thank you, Lord Mayor. I just want to support the leader and second the paper and the motion here. And I just want to touch on the test and trace arrangements that have been in place and perhaps how we could improve them for the city. We have seen infection rates rising across the country, and we're pleased to see them stabilising in Leeds recently. But over the past number of months since March, it's really been clear that tests have done an awful lot better. I'm quite sure we would all agree that it hasn't done what it should have done and what it could have done. And having had £12 billion spent on it, it really, really could have been delivered an awful lot better. SAGE advised needs to track and trace and talk to 80% of contacts to be effective. But recent figures show it's expensive and it's obviously outsourced in a national system. It's really struggled and it's reached less than 58% of people. Whereas a local protection team have tried to reach people, we've reached almost 95% of contacts. So Serco and Citel's contracts with government were extended despite this, and that costed a projected £700 million. You really have to question the paying of private consultants as much as £7,000 per day for their input on a system which really has shown to be wanting. All the way through this pandemic, we've seen announcements from government that we're going to give local authorities and public health teams the responsibility to do this work, and yet it really has never come down to us. We've got long-standing relationships with our communities and a history of handling infectious diseases and outbreaks, and the health sector can provide, a really good clinical analysis service as well, better than the outsourced testing system, we think. It's really essential, as a standard throat swab test doesn't tell us how infectious someone is, and up to 29% of tests have proved false negatives as well. Under the government's Operation Moonshot plans, 10 million tests a day will generate 10,000 people testing falsely positive in the day and result in unnecessary isolation and hardship, while costing 70% of the annual NHS budget for England. And we need a better balance between quantity and quality. So here in Leeds, our public health team are introducing a local contact tracing advisory service, which will provide an effective local response to advise and support contacts of positive cases, work alongside the National NHS Test and Trace Service at the same time, and enable support services to be put in place for those needing to isolate. It will prioritise vulnerable groups. Sorry, Lord Mayor, is that me out of time?
No, I think.
Oh, sorry. Okay.
Members, please mute your mics, please.
Yeah, so as we always do, we'll prioritise vulnerable groups, people with increased risk factors, and those living in the most deprived areas, and linking them in with local support. And we're aiming to improve contact tracing rates to a minimum of 80% and add value to the national system and really do a better job for the people of this city. We really need to improve the test and trace system. And the best thing that Boris Johnson can do is to really stop wasting money on ineffective privatised elements of the national system and learn that we need to localise this and work with directors of public health and local authorities. Thank you.
Thank you. Councillor Carter.
Yes, thank you, Lord Mayor. And in moving this this amendment, which I do with some regret, I want to say, first of all, that my group and I entirely endorse the recommendations in the report marked A to E, but wish to add a further recommendation. Interesting to hear what's just been said. I listened to President-elect Joe Biden, who I admit I'm pleased has been elected, yesterday on the US response to track and trace and COVID in general. And he used some interesting words. He said, "We will follow the science and change course wherever required as the science dictates." And that's been welcomed by people all over the world. And yet here in Leeds, we have exactly the same approach by the British government, being criticised continuously. It's not helpful, doesn't help to maintain an all-party approach. But in moving this amendment, I want to make clear, first of all, particularly in the light of the implications of what Councillor Blake has just said, I want to say what it's not about. I want to make it crystal clear what it's not about. It is not a criticism of our partners or our officers, whose briefings have been exceptional and very well received by all of us. I'm in something of a privileged position because I've received probably those briefings more often than anybody, with the exception of the leader, including briefings from London. So this is not a criticism of our partners or our officers, who are doing a splendid job in doing what they can in their own settings to defeat this dreadful pandemic. And indeed, the Outbreak Board to which I'm referring serves a very useful purpose, to keep us briefed, in particular by partners and organisations across the city. But it is simply that, a briefing. And it's very good, but it's not political consultation. Too often members of this council, including on the Labour benches, are faced with fait accomplis which they are informed of second-hand or through the press. And I'm forced to say, in the light of the comments from Councillor Blake about things leaking from government, I agree with her. It's not acceptable, but it is a question, really, in Councillor Blake's case, of the pot calling the kettle. So as we move into a new period in our fight against COVID, we have to minimise the democratic deficit and try to keep everyone on board. Many decisions are being taken by officers that would normally have much more political input. After the event is not enough. We have, of course, another COVID outbreak board comprised of leaders or their deputies and all groups on this council. This should be used as a vehicle for proper democratic input and consultation, as well as briefing. We can't go on for months, probably without face-to-face meetings, and not have some much more robust mechanisms for open political discussion, particularly around measures that we will have discretion to take in future on COVID. We want all to work together, but discussions after the event aren't acceptable. And if the leader truly wants to maintain all party working, and I hope she will accept that throughout I have endeavoured to support the council, and indeed I was requested to use back channels to ensure we got the funding that we got, which I was happy to do. So I say this directly and quickly to the leader of council. If you again are unable to take on the context and the substance of what I've said, please do not deliberately misrepresent them. This is far too serious a matter. I move.
Councillor Dobson.
Thank you, Lord Mayor. In seconding the amendment, I would also like to add the support of our group around the report marked A to E, and to thank the Leader of Council and indeed officers who I do know have worked tirelessly and relentlessly over months and months and months around this agenda, and those thanks are heartfelt and genuine. But to elaborate on the points made by Councillor Carter, looking at F to G, I think there are some points that really need to be highlighted. After many months of bitter experience, we all know what COVID-19 is. But let's talk a little bit about what it isn't, because it doesn't know ward boundaries. It's not political in nature. It does strike indiscriminately across boundaries, although one would have to accept that in some of our poorer communities, they are affected more for reasons that we're all fully aware of. But COVID knows no bounds. It certainly doesn't know political bounds. I've watched the debate at a national level over many weeks and months, and Sir Keir Starmer, the leader of the opposition, has been right, I feel, right on many occasions to call for greater cross-party involvement at a time of national emergency. But I think as a city, we must expect no less. My colleagues will elaborate a little bit later in today's meeting around the fact that even finding a seat at the outbreak board has been difficult, and at times it has been extremely difficult to actually get the most basic information around very, very serious outbreaks and public health issues in our particular community. But I'll leave that to others, because it has been, I have to say, in terms of the administration, a slow response in that regard. But let's rule a line under that and see what we can actually do collectively. Because I have to say, there's a lot of talent in this council across the 99 members. And there are people from all parties who are ready, willing and able to serve and support the administration in a meaningful, constructive way around shaping this city's response to the pandemic and going forward in our negotiations with government. I say this many, many times over, Leeds is a massively diverse city, and all the voices from all the communities have to be heard and understood and articulated through us, the city's representatives. I sincerely hope that as a collective community of people, we never have to face anything as significant and serious again in our lives, and certainly in our political lives. But we must move forward collectively, especially at a time when the vaccine is on the cusp of being released. Never more so do we need full and proper engagement at a serious and meaningful level. Thank you, Lord Mayor.
Thank you. Councillor David Blackburn.
Thank you, Lord Mayor. Thank you. While I've got to say that we have all along tried to support what the council's been doing, and I've got to say, in the early stages, felt that we were being consulted properly. I've got to say that as things sort of bedded down, and we felt that we were sometimes being ignored, and I'm glad to see that we set up this members board, COVID board. But the fact is we all want the same thing. We want our citizens to be safe from COVID, and we want to work together for that benefit and not score political points. So what we need is proper information. We need briefings at proper times and not when it's convenient. I think we've had 3 members COVID boards, and the last but one, which was caused at short notice, where we expected to be going into tier 3. I said, can we have another one if things change dramatically? Well, we did have another one, but we had one the week after, it lasted an hour. That was before the whole council got briefed on going into lockdown. I think what we've got to do is not do what the government do. I fully support Judith in what she says about central government, because central government idea of consultation is we want to do this, you agree with us. Well, we don't want that in Leeds, and we don't want that nationally. But what we want to do is we want to sit side by side with Judith and other leaders of the parties and together say that we are speaking in one voice for all our citizens and for all our councillors. And that's what we need to do. And I do not believe that that's what we're getting at the moment. As I say, I've got lots of time for what's been done during the last few months. There's a lot of it I couldn't argue with. But the fact is, we've got to have that proper consultation. I'm glad we set up the members' COVID board, but it needs to be their meeting before things happen, not afterwards, so that we can have everybody's views. Thank you, Lord Mayor.
Councillor Galton.
Thank you, Lord Mayor. I have to say, my group viewed this amendment with some confusion, because one thing that we can say about the council is it has disseminated huge amounts of information day in, day out to us. And when, for instance, we wanted more information about what the COVID infection rates were in our own areas, it was differentiated down to a ward level. And most of the delay in accessing such information seemed to me to be because that information wasn't being filtered down to the locality in the first place by the centralised structures that government had decided to depend upon in its forefront against the COVID pandemic. And I see this amendment now as a general level of frustration, because everybody seems to be saying they agree with all the first 5 recommendations that were already there, congratulating everybody for sharing of information and all the efforts that our council and partners are doing. But there's frustration that people aren't getting the information when they want and that they're not being consulted on the decisions that are made. And I have to say I'm concerned about that, but mostly because the decisions that are being made by central government and are being semi-imposed upon us by saying, well, we're going to negotiate with the local authorities, but those negotiations seem to be very one-sided and primarily are concerned with money. And our concerns as local leaders are, we want to respond to the fears and needs of our constituents. And we can give them lots of information about what is happening, but what they want to know is what's going to happen and what are we going to be able to do to influence it to make it different for our locality. And Andrew Carter has pointed out in his speech that he thinks there's going to be so much more of that local agency for us to start spending the money that is available ourselves and in the style that we wish to. But up till now, it's been very limited in terms of what we are able to do. And I have to say, pushing the majority of the COVID response money into these private contracts without any kind of competition to access to them has basically taken all of the stores from the larder that we should have to fight COVID, stuck them all in the private sector camp, put an NHS sign on top of it and said, oh, it's the NHS, but it's not really. And it means that we've got less to work with in our own locality through our own NHS partners. And I would like to see, when Councillor Carter is talking about the government changing its mind when circumstances change, when your test and trace system does not work, please do something different and let the localities who already have their own test and trace systems set up invest in them. Thank you, Lord Mayor.
Councillor Hutchinson.
Thank you, my Lord Mayor. I guess Leeds City Council, we have one chance and one chance only to get this right. And just for the record, the MBIs do fully support the report items A to E, but equally we also endorse the amendment F and G. I'd also like to take this time as well just to thank the leader of council, officers and also colleagues who we know have been working tirelessly in reacting to the pandemic in the Leeds area. But there is certainly a sense that the COVID outbreak board is a token gesture to the opposition parties and certainly the minority parties. It's almost a way of making us feel that we're involved when really we don't feel like we are involved. We don't feel like we are being listened to. We don't feel that the consultation sort of takes away our concerns. I guess similar to Councillor Blackburn, more regular meetings and proper consultation we feel is needed. And as far as I'm aware, we live in a democratic Leeds, and it should be a democratic decisions and possibly all party working together to make sure that Leeds comes through this a good city and with minimum impact. That's all I have to say. Thank you, my Lord Mayor.
Councillor Lamb.
Thank you, Lord Mayor. These are incredibly unprecedented times. It's impossible for anyone to get absolutely everything right, but we have to be fleet of foot, ready to change things as necessary and recognise where things can improve. Many members have said that already during this debate. I want to touch on a couple of things in supporting the amendment by Councillor Carter. The first thing is there is a lot of value in the COVID Response Board. I've sat on it twice as a substitute for Councillor Carter. The partners bring a lot, and it is essential and important that we keep that relationship going. One thing I would say is there is certainly space for more business input into that board, and perhaps that's something that could be reflected on. But there is a huge amount of value, and we're not, in making these amendments, in any way denigrating the work and contribution of partners to the city's effort. What that board is not and cannot be is an accountability board or a board which is helping to shape the city's response. That is something that only people who are elected to serve can fulfill. And that is really the thrust of this paper. It is for all elected members of all parts of the city, of all political parties, to be part of this. I think we could all agree that the people of this city, the people of each community we're elected to represent, would expect us in the most difficult times to put our political differences aside and work together to do the best for all the people of our city. I don't doubt the intention is there to do it. What is in doubt is the mechanisms to make that happen. One example I'd give, I sat on the COVID board just as we were on the cusp of going into tier 3 on the COVID outbreak board. Members will recall the members briefing was cancelled that day. The outbreak board went ahead, and it felt to me wrong, despite the value that was being brought by partners, that elected members were being left out and briefed second to partners. The people who are, and that's from all parties. That's not a party political point. It didn't seem right to me that elected members were being treated second in that way. We should have been consulted. With responsibility comes accountability, and that is why it's essential that the Leaders Board is the mechanism to shape and lead the response to this outbreak going forward. There is lots of good things being done by the council. Congratulations to officers and elected members. It is an incredibly difficult time. I hope Blake and the administration will look and accept this amendment in the spirit it's been brought forward, which is simply to do what the people of our great city expect of us, put our differences aside in difficult times and work together to shape the city's response. Thank you, Lord Mayor.
Councillor Galton, sorry, Councillor Prayer.
Thank you, Lord Mayor. I'm really pleased to be able to add to the speeches from Councillors Blake and Charlwood on the work they've been doing in the response to the pandemic. And actually, after a series of opposition speeches about how we haven't had enough meetings, I'm really pleased to speak now about what's actually happening in our city. So I hope we can all agree that our schools have been absolutely outstanding during the course of the year. They've remained open, enabling key workers to continue working and to provide a degree of normality to our vulnerable children. They've managed a constantly changing season of exams where the goalposts shifted from week to week, adapted to last-minute guidance and rules, and most recently, they've once again been there for some of the most deprived children when the government turned their backs on them. So how are our schools managing? The DfE recently issued a survey that asked if local authorities could share with their primary schools and return the results. And the picture it shows is that in Leeds, a number of our schools are under significant pressure. 86% of primary schools who returned the survey said that funding restraints are affecting their staffing decisions. These are decisions that are taken because staff are either off ill or isolating, supply teachers need to be paid for, and a lot of schools simply don't have the budget to cover this. Funding issues do go further though. I've mentioned before that schools have spent £8,000 installing additional sinks with no way to claim that money back. The additional cleaning supplies are also proving to be another unexpected pressure. It may not sound like a lot, but it's enough to thoroughly clean an entire school is surprisingly expensive. Then there are logistical issues. How do teachers manage to teach in classrooms at the same time providing effective home learning and catch-up classes to children who themselves have been isolating? The strain on mental health is really beginning to show. And half term was not a holiday for many senior leaders and staff, as they spent it undertaking track and trace calls, updating risk assessments and websites. There's been no downtime for a lot of our school staff. COVID has taken over everything, leaving no time for school improvement plans or basic annual tasks. The government are still insisting on exams next year, and schools are worried about performance tables. We know that more bubbles are collapsing in the north than the south. And actually, without decisive action now, this disparity that already exists in outcomes for children from the north and the south will continue. I mean, will this just be another case of a problem being considered unimportant until it starts to impact the south? Just as we saw with the Chancellor's 80% furlough scheme, once it was clear that the south would be in lockdown as well. Schools were asked what they needed, and the answer was clear. They needed proper funding, and they needed a proper track and trace system that actually worked in place. And sadly, I'm afraid the government has delivered neither of these. Thank you.
Councillor Cohen.
Thank you, Lord Mayor. And I would like to also share my thanks to our schools for their amazing work in staying open and being there for our young people. As someone who's been in schools, teaching and supporting in schools since we reopened in September, I can see the difference and the importance it's made to our young people. Absolutely, there are challenges. Equally, the government has made additional funding available to schools. Is it enough? Funding is always going to be a challenge, and I would join any calls for additional funding for schools. But there has been additional funding. To pretend otherwise is frankly trite and unnecessary. Is it enough? Again, I share the view that we can always use more funding in education. But this amendment that Councillor Carter has tabled, it is really about looking at what we're doing as a city, recognising all that is good in this report, and simply saying, actually, we need to find a way of improving our cross-party working to get better decisions. And the ideal forum for that is the cross-party, the all-party COVID response board. I hope we are not going to have a series of speeches seeking to politicise what is a tragedy. I don't believe that's what Leeds residents want to see. I don't believe it's what Leeds residents expect. And Lord Mayor, they'd be right for that. Our job as councillors is to be Leeds city councillors in times like this. One Leeds, working together for the good of the whole city and for all our communities. Thank you, Lord Mayor.
Councillor McCormack.
Thank you, Lord Mayor. I'll begin by expressing my admiration and gratitude to all council employees and officers for their dedication and commitment during this tremendously difficult year.
Could you please put your cameras on, please?
There. They have risen to the challenge, adapted to a completely new way of working, ensured the delivery of essential support to our communities and the continuation of our public services. Whilst Monday's announcement of a vaccine offers a glimmer of hope for a return to normal life in the future, there is still much work to do in tackling this second wave and the widespread transmission we're now seeing in all parts of the city. News that COVID had really come to town in Garforth reached residents at the beginning of October by way of the interactive COVID map showing a sudden but unexplained spike in positive cases. At the same time, my ward colleagues and I received the notification of a major outbreak from a single location. 64 positive cases out of a cohort of 172. Whilst happy to follow the confidentiality protocol for the low number of isolated cases we'd been notified of previously, to ask us to do so on this occasion and to not have been included in discussions as to how the outbreak would be contained showed very poor judgment. We had to spend the weekend fighting for answers whilst panic ripped through our community. By the time we were given access to the vital detail of the situation 4 days later, the number of positive cases had increased to 78. A further 7 days later, when we were given a follow-up briefing, the number had increased again to 89 confirmed cases. That's 89 out of a group of 172. Dealing with the pandemic has been a steep learning curve for every single one of us. And following the mismanagement of this outbreak, we've been assured that lessons will be learned. The establishment of an all-party COVID response board would be a step in the right direction. The Leeds COVID-19 control plan produced in June states that effective communication and engagement is key. The importance of honesty, openness and transparency is referenced throughout the document, along with a commitment to working with people and not just informing them. This is the right
I think we have lost Councillor McCormack. Can we move on to Councillor Anderson, Barry Anderson?
Thank you, Lord Mayor. I support the amendment in the name of Councillor Carter. We owe a large debt of gratitude to our volunteer army in this city, and we now need to re-energise them and remobilise them because of what is going to be ahead. There might be a vaccine found. However, it may, even if it is, it may still take until spring or Easter before we see more positive results altogether. There will be a renewed need for food distribution, shopping facilities, prescription collection, and welfare calls. As a council, we've done great work in working with Val in order to regenerate these volunteers. We've also done a lot of great work in refreshing the volunteer hubs and sharing best practice. And Val have been successful in getting additional funding coming into some of our volunteer hubs. But have they assessed and have the council assessed the needs of all organisations, including those in the outer areas? Do we still have access to all of these volunteers, or are some of them no longer available because they are either been ill themselves or are going or have gone back to work? How successful has the Doing Good Leeds website been? There's mention of it, but there's no mention of how successful or otherwise it's been. Do we need to ramp up the Leeds survivor led crisis service? Is there more needing to be done there? Has the work of the third sector resilience work plan been completed yet to include the lockdown and to include tier 2 and tier 3 works? What I'm really arguing for is that let's keep it local. Let local ward members determine what is best for them. Let the council devolve the funding that they're getting from government down to local ward members or to community committees to actually make the decisions for themselves so that we can work with our local communities to get the best for them. Thank you, Lord Mayor.
Councillor Beto? You're on mute.
I'm absolutely delighted to continue in a similar vein to our group's messages. Here we are back in lockdown, a reminder that this pandemic is far from over. it needs sacrifices from all of us for the common good. In March, Boris Johnson said no one would suffer financially for doing the right thing. That making sacrifices for the health of the people of this country wouldn't lead to debt or undue strife. As we come into another lockdown, still feeling the pain of the one before, we all know he didn't keep his promise. The government tells us, incorrectly, the minimum wage is the very least you need to survive. I'm proud that we are a living wage employer, but many places aren't. Over the first lockdown, anyone on minimum wage, which remember is not enough to live on, was getting just 80%. When the North was being moved into harsher restrictions, the government were threatening 67% of normal wages, a third less than the bare minimum you need. Rent doesn't go down, heat and bills don't go down, the cost of food doesn't go down. It's only when jobs in the South, and I say this as a Southerner, are under threat that we see the government go back to an 80% furlough scheme. We know that COVID is hitting our disadvantaged hardest. Some lost jobs when the first round of furlough ran out, or even beforehand. Others have been pushed into in-work poverty. It's a heartbreaking fact that food poverty is on the rise. As one of the richest countries on the planet, there is no excuse for food poverty increasing. But it's quite a sterilised phrase, is food poverty. So I'm going to switch it out. What food poverty actually means is that people are kept on so low an income that the family can't all eat. Some members of that family go to sleep empty. Every single member of the government should ask why they chose this. It's a mark of shame they'll have to wear for a long time. But enough about the government's failings, much as I could obviously go on about them all day. Councillor Cohen, for once, is sort of right. There is so much in Leeds to be proud of. I'm so proud of the work that the local authorities and our communities are doing to pick up the slack. I'd like to thank every officer, volunteer or contributor who stepped up and gone beyond the pale. I'd like to particularly take this opportunity to thank organisations in my own area of Kirkstall that have done so much for so many. We literally couldn't have done it without you and those like you across the city. We've delivered food parcels via a central warehouse facility jointly operated by the council, Fair Share and Rethink Food. At the peak of the crisis, that warehouse was delivering 4,691 food parcels a week. And that's not even all. Almost 64,000 food bags were distributed to the emergency food service in Leeds. Okay, just a tiny bit more about the government. As we go into a second lockdown and beyond, where once again Leeds City Council will absolutely be there for you, our government must finally show leadership and decisive action, giving us the funds we need rather than this whiplash from U-turns. And directly at Boris, because I can hear my time's up, clearly in the last few weeks, we found out that our communities will no longer take your nonsense lying down.
Councillor Bennett.
Lord Mayor, in Leeds, we were working hard to limit the impact of child poverty, which after years of Tory austerity was already worsening before the coronavirus pandemic. Now it is acknowledged that child poverty is becoming its own national pandemic, compounded by the government's shameful failure to provide free school meals over half term, which affected 29,500 children in Leeds. Before the crisis, 35,000 children in Leeds lived in poverty. The Children's Commissioner estimates a further 300,000 children have been pushed into poverty nationally. In Leeds, we recognise the scale of the problem and the heartbreaking impact on children's lives. The community and the council have acted much more quickly, effectively and compassionately than national government in combating the added insecurity the pandemic has brought. Earlier this year, when the government's National Free School Meals Scheme was plagued by problems, we adapted the work of our child poverty strategy and our existing partnerships to provide emergency food, fuel and shopping vouchers. The Healthy Holidays programme, run by Leeds Community Foundation in partnership with the council and others, is exemplary. The funding was stretched as far as possible to provide a fantastic range of activities and food for children who would otherwise have gone hungry and had little or no access to activities. Council ensuring children do not go hungry is a moral duty. In Leeds, we stood by Marcus Rashford and all those who fought to get the government to undertake yet another U-turn. We worked alongside individuals, food banks, restaurants and others who stepped forward when the government once again failed children. As a council, we will continue to build on the solidarity, generosity and collaboration shown in our city over recent months. But whilst we will do all we can to limit the impact of child poverty, we do not control the levers to lift people out of poverty. The power and resources we have as a city are simply not enough to provide for every child who needs support. While we welcome the U-turn on feeding children at Christmas, we need a more sustained approach. We call on national government to address child poverty head-on with a political courage and a morality which has been seriously lacking over the past decade. In these desperate times, they must reinstate the target to abolish child poverty, which the previous Tory government scrapped in 2016. We need urgent action to strengthen the ability of councils to support children and families. We need funding so we can maintain our preventative and early help services. The government have clearly decided that child poverty is not a priority, but we will not stand by and let children and families be victims of their failure to act. Thank you, Lord Mayor.
Well done, Fiona.
Could members again please mute your mics? Councillor C. Anderson.
Thank you, Lord Mayor. I support the amendment in the name of Councillor Andrew Carter. I'd like to concentrate on the issue of seeing loved ones in care homes. This week, a resident got in touch to ask about visiting her mother in a care home locally. She outlined a situation where herself, her brother and sister and her father are all suffering from not being able to visit her mother in the care home due to the strict no visiting criteria the home has put in place. Her mother and father have been married for nearly 60 years, and as she put it, my mother is his life, and now he can't see her. The email was so emotional, you could feel the tears coming from it. What was more upsetting was the thought that when she does go to drop gifts off or flowers for her mum, she doesn't know whether her mother may only be a few feet away at the other side of a wall from the reception area, and she can't get to see her. Or worse still, that her mother sees her coming up the path, but doesn't understand why and doesn't then come in to see her. This isn't a unique case, it's going on across the whole country and it's heartbreaking. This is not the fault of anyone in particular. Care homes are terrified of having COVID circulating in them, quite rightly, but there are safe ways that visiting can be done, and the director and her team are working with the care homes to try and resolve this, to try and give them confidence to have secure areas for visiting or visiting through windows, and they're making suggestions for visiting policies that are not so rigid. Government guidance has shifted in tone recently from visits being almost by exception to being far more permissive and visits being a human right. This will help the homes to put some good practices and visiting policies in place. Factors taken into account are harm that will be experienced by residents from a lack of visitation. Identification for the types of visits will have to be done on a case-by-case risk-based approach undertaken by the care home. The government has advised families not to visit but has not banned such visits, and care homes are advised to merely restrict visits of all types of those that are not visits of all types to those that are deemed essential, and that will be because there will be harm caused by lack of visitation. If this can be achieved for the case I have outlined, this would improve the situation for 6 people. What a difference that would make. Thank you, Lord Mayor.
Councillor A. Blackburn.
Thank you, Lord Mayor. I'm going to first of all say that I support the we support the amendment as well, because I think that that would certainly improve things if all parties can work together and are all suitably briefed, so that yes, hopefully we can all do the best we can for Leeds. It's not a time to be point scoring now. There's people out there, as we all know, dying of this terrible disease. So we need to work as one on total level playing field. I think we've started, as has been stated, with having this, with the smaller parties now being represented on the outbreak board. But I think with that, certainly things could, that we could have more input. I'm sure that it would be better for the people in Leeds if all the parties had equal input on this particular issue. And I want to change dramatically and state about the wearing of masks. And of course, some people still are not wearing masks that should be. One little thing is that I keep seeing a drawing, little drawing done of a mask, but there's, that might sound stupid, no nose there. And so I have seen people going around with masks on, but they're not covering the nose. So that's not much good, really. I've challenged people I've seen, and in a nice way, not wearing masks. But then we have the matter of people will say they're exempt, and I'm sure there are a lot of people that are exempt. But having said that, if you challenge people in a nice way, yes, I suppose it's a thing that anybody can say. So I think there's little things there that maybe working with the government that we could do that would just make it clear how people are supposed to wear a mask. If you've got a photo with your mask on, it makes it clear you're supposed to wear it over the nose. And also people going in shops without a mask on. Again, it's these little things that all add up.
Councillor Blackburn.
So that is it, really. Thank you, Lord Mayor.
Councillor Robinson.
Thank you, Lord Mayor. I also join in supporting Councillor Carter's amendments, adding F and G to the report, and welcome the report and thank the officers involved. Can I also take the opportunity to express my heartfelt condolences to those that have lost loved ones through coronavirus and through COVID. I can only imagine what a difficult time it is for them. I wish to focus on a couple of elements, if that's okay, Lord Mayor. One is the business impact that COVID and the restrictions are having. I was driving through the city centre the other day as I had to come back from an appointment, and it feels like we have a zombie city centre now. The lights are on, but there's not a lot of action and not a lot happening, and there is a real risk. And having spoken to a business owner in this city, he made it abundantly clear to me that the changes we have now are long lasting and will last forever. There is no going back now. There are businesses who have taken steps to bring in more home working, and they will not be taking back up office space in the same way that they did before. There'll be businesses that will be closing down as well because of this pandemic and are going through real financial hardship. And I hope that, as Councillor Lamb said, there can be more business input to the boards that are there, because the response board will have a role long after COVID is finished and there are vaccinations have started and that people are getting back to normal. The pandemic response is going to go on for years. The second element I wish to touch on is there has been funding made available for discretionary grants. We know that was previously discretionary grant funding and 1.1 million was left unspent. I hope that does not happen again as we go through, and I'm certain that officers will be making measures to taking measures to make sure that doesn't happen. But reassurance is that businesses who missed out last time can access that grant this next time would be very, very welcome. Finally, Lord Mayor, Councillor Bithell mentioned that that bills go up through this period. It would be worth adding that the council tax bill is anticipated to go up for residents across Leeds in April next year. That will impact on the lowest earners and those who are struggling most. As we go through this pandemic, it is incredibly difficult for those people, and to be kicked in the teeth by a council tax bill increase is going to be really hard to take. Thank you, Lord Mayor. I'll stop there.
Councillor Mulherrian.
Thank you, Lord Mayor. As members of council know, we've introduced a range of measures to support communities with active travel throughout the health crisis through the government's Emergency Active Travel Fund. We began by creating more space for people to walk by and safely queue at essential shops during the first lockdown. Since then, we've introduced segregated cycle lanes, school streets initiatives at 14 primary schools to enable children to walk safely to and from school, and our first active travel neighbourhoods, also known as low traffic neighbourhoods, have gone live this week. Each of these schemes is being developed in collaboration with ward members, listening to feedback received from the letters that have gone out to households in the residential streets included. They prioritise the safe movement of people in residential areas on foot, by bike, by scooter, by wheelchair, and by closing roads to through traffic to deter rat running through residential neighbourhoods. We're receiving lots of responses from members of the public and businesses where we've introduced these schemes. The vast majority of those so far have been positive messages of support, residents grateful for measures that will deter drivers from rat running through their streets, and parents happy that their children can safely walk to school. Our highways teams worked incredibly hard to apply for the government's emergency funding, then to design and implement these schemes in very tight timeframes. And I'd like to express my thanks to them and to the public health and active Leeds officers who've supported and external partners who have helped to inform the process. The work they've done in incredibly tight timeframes that was required by the government funding has been exemplary and shows the dedication we have in this city to meeting the challenges for our residents during this unprecedented health crisis. Extremely tight timescales were set by government for the funding bids and for these schemes to be delivered, but we're still waiting for the announcement of the second round of funding. That was due in August. Nearly 3 months on, we're still waiting. In the meantime, I'm sure that we're all aware that the government has been under pressure from many of its own MPs to backtrack on its approach to supporting cycling and walking, emergency measures that Grant Shapps championed in the first round of funding. I hope that he and his government will withstand that pressure and continue to both support and promote a rebalancing in transport infrastructure to enable more of our communities to benefit from segregated cycle lanes, from safer streets to walk and play in, for neighbours to talk in, for children to walk to school, and for businesses to make better use of the outdoor space around them. Officers are meeting virtually, as we are today, with government officials to discuss the second round of funding, and I hope that the government will recognise the need to continue to prioritise these measures and to give us the time to implement them, working more closely with local communities we serve the second time around. Thank you, Lord Mayor.
Councillor Finnegan.
Thank you, Lord Mayor. Can we start by thanking council workers and those volunteers that are making the city and the town of Morley work better and work more effectively. I'll be very brief on the rest. Central government makes decisions secretively and without consultation, with little explanation, and is selective in the information given. Leeds City Council makes decisions secretively, without consultation, with little explanation, and selective information is given. That leaves a democratic deficit, and as such, Leeds needs to do better. I support this amendment, as does the MBI group. Thank you, Lord Mayor.
Councillor Stevenson.
Thank you, Lord Mayor. Following on from comments made already by colleagues, I just want to add two specific points to the debate. To record my thanks to the voluntary efforts in the outer northeast of the city, and to comment on the huge achievement reached by the pharmaceutical industry through research and development this week. In supporting Councillor Carter's amendment in respect of elected member involvement, like many other areas of the city, the Harewood ward and its neighbouring rural and semi-rural communities mobilised quickly in the spring to provide assistance to those in need, often the elderly, who had no access to family support networks to help with shopping and medical supplies. This brief set of second restrictions has triggered another surge in community spiritedness. We're extremely fortunate in the outer northeast to have Wise, Weatherby in support of the elderly. Mark and his team have worked tremendously hard in difficult circumstances to expand the neighbourhood network at short notice and be the delivery arm of the Outer North East COVID response team, ably chaired by Councillor Harrington. Anecdotally, we've heard how the Outer North East has been used as an exemplar in other areas of the city, and this achievement could not have been met without the willingness and altruism of many volunteers. The term hero is thrown around far too easily these days, Lord Mayor, but the community heroes that we've seen in our patch have been tremendous, and we thank them for their work. I think it's also right to recognise the medical and scientific excellence across our city. Dr. Alison Pittard from Collingham was awarded an OBE for services to critical care in Her Majesty's Birthday's honours. But such excellence extends throughout the UK and across the global scientific community as well, specifically within the pharmaceutical sector. It's quite simply stunning to see how quickly trials for the COVID vaccine have progressed, over 45 different vaccines in trial, with the Pfizer-BioNTech model being rolled out in coming months. This breakthrough within the pharmaceutical sector has highlighted how investment in research and development within a competitive environment has delivered well for all countries when called upon. All members across this council should rightly praise those within the pharmaceutical sector in universities from Leeds and across the country who have helped deliver this achievement. It also provides a moment for reflection, specifically to those members who campaigned less than a year ago on a manifesto pledging to obstruct those very pharmaceutical companies with a plan to nationalise the industry and cut its collaboration with our National Health Service. Here's hoping, Lord Mayor, that the vaccine is less bitter than the pill now being swallowed by some politicians.
Councillor Almas.
Thank you, Lord Mayor. As we're all aware, COVID-19 has caused hardship for so many, with lost income, being on furlough, or because they relied on free school meals for their children. On top of that, the NHS was in desperate need of supplies to help it deal with the increasing number of COVID patients in hospitals. Our thoughts are with everyone who has lost a loved one or friend to this dreadful virus. However, we must also never forget how the key workers and many volunteers all stepped up to help respond to this crisis and even dropped school meals. We saw a fantastic response from key workers across Leeds, and that includes our firefighters. As one of this council's representatives on the West Yorkshire Fire and Rescue Authority, I would like to highlight some of the incredible work by the firefighters in response to the pandemic. Since March, firefighters have not only been performing their regular role under very difficult circumstances, but they have also gone far beyond this, and they have a virtual lifeline to communities across Leeds and West Yorkshire. They volunteered to deliver much needed food and medical supplies to help the increasing number of people in desperate need. They were even trained to drive ambulances in preparation for transferring patients to the Nightingale Hospital, and trained to help set up run temporary mortuaries. They delivered much needed PPE to care homes, provided fall assistance to the ambulance service, and even dropped off school meals. Much of this work carried on through the summer, and I can reassure members that firefighters are ready to volunteer again on what is shaping up to be a very, very tough winter indeed. I'm confident to think, Lord Mayor, that I speak for all of us when I say how grateful and appreciative we are for their efforts. Respect. Thank you.
Councillor Arrington.
Thank you, my Lord Mayor. It's clear from the comments by many colleagues this afternoon that we continue to face a very serious situation in relation to COVID-19, and it's right that we devote significant time to it at full council. I don't think anyone could have predicted in February that we will be facing a global pandemic with many of our high streets closed and many of our normal social interactions now deemed to be at risk. The speed at which this has moved and the sheer scale of its impact is truly frightening. Set against this backdrop, it's difficult for national and local politicians to find a way through it. Not everything has been perfect, either locally or nationally, and there are many different opinions ranging from those that argue for more support to the economy and more limited lockdowns, and others who have called for stronger restrictions on daily lives, and there are also those that have also called for something in between. It seems that there is no right answer, or at least no 100% right answer. We must therefore continue to try to strike a balance between providing as much protection for our economy as possible, whilst also having that clear focus on saving lives and reducing transmission. Of course, news earlier this week of a potential vaccine is hugely welcome and now offers clear light at the end of the tunnel. But for the time being, we must still ensure that the spread of the virus remains as low as possible. My Lord Mayor, our group leader Andrew Carter has submitted an amendment to this report that looks at how local arrangements can be better managed to ensure that we all work together and that everyone feels involved in decision making during what Councillor Carter rightly describes as a genuine crisis. Just as members opposite have criticised the government, and boy have they done that this afternoon, it is also true that things could have been handled better in Leeds. We've often said it's important to take responsibility and deliver for the people of Leeds and to develop a positive working relationship with the government to get the best for Leeds. Those points apply now more than ever. It's clear that in unprecedented circumstances, the government is working hard to strike the balance between public health and protection for our economy. They have provided massive support for businesses, the self-employed and workers, and much of it has been a genuine lifetime to people. And I know many residents in my own Wetherby ward have benefited from that. It's also true that significant sums have been granted to local authorities and the wider public sector to deal with the crisis. Some of that may have been handled better. My Lord Mayor, it is now even more important that we're able to work together to find a way through this pandemic to protect lives and protect our communities. The vaccine offers hope, but in the meantime, we must ensure that Leeds residents are kept safe, whilst also ensuring that Leeds businesses are able to survive and recover when a vaccine does become widely available. Thank you, my Lord Mayor.
Councillor McKenna. Councillor McKenna.
Sorry, Lord Mayor, I was muted. Lord Mayor, like my fellow councillors, I'm pleased to take this opportunity to send our grateful thanks to the organisations in the Army Ward who has kept our communities going during the pandemic by delivering food, hot meals and medical. And the two main ones clearly are New Wortley Community Centre and Army Helping Hands, who have both received a blue plaque for their efforts during that time. I'm also following on from Councillor Bittle's comments regarding leadership, local leadership, and I'd like to inform the council that at the last Army branch meeting, Councillor Judith Blake was praised and commended for her leadership of the city, all her hard work and dedication, and how she's handled it, not just for Leeds, but I would say on behalf of West Yorkshire. I think, unfortunately, the government has acted too slowly during the pandemic. They are always 2 and 3 weeks behind. When I was in Dublin in March for a family funeral, 10th of March, Ireland locked down almost days afterwards, in line with some other European countries. I came home and I was amazed to see that we didn't lock down till the 23rd of March, at least 2 weeks late. However, there are good news locally. I can tell you that my 6-year-old grandson, who is disabled, was sent home from school yesterday with a cough. We arranged for a test for him at Templegate at 6 o'clock last night. And I was delighted to have the result back by 11 o'clock today. He was clear. So at least we are doing a lot locally that is to be commended, and we should celebrate that. Unfortunately, our policies has not made it easy to fight this pandemic. It is clear that austerity has left lasting damage on our country and our ability to cope during a crisis, mirroring 60% cut in government funding to local authorities over the last decade. The budget for Public Health England has been cut by 40% between 2012 and 2020, and local public health has had its budgets reduced by 700 million in real terms between 2014 and 2020. These are all grim statistics.
Councillor McKenna.
Thank you, Lord Mayor.
Thank you. Councillor Wedgworth.
Thank you, Lord Mayor. Well, coming at the end, you have the advantage of listening to everything before you, don't you? And I've listened to a lot. Councillor Bither and Councillor Venner, I think you got the wrong speeches there. I think you used a speech that you should be using for the white paper, because you didn't appear to mention COVID at all. Councillor Mulhern did get halfway there, though she started to talk about money, and Councillor McKenna seems to have had a good experience with testing over the last few days. So that's something going right. But there's something not going right in the city, because with 8 wards over 500, something is actually going wrong. And so Councillor Carter's amendment attempts to try to put things right. And as a ward member of myself, I do feel that when we get briefed, it's a telling exercise rather than a asking exercise. We are told what is going to happen, when it's going to happen, and not really given a lot of choice over it. And members may think that this is sort of coming to an end, but it's far from coming to an end, and businesses are going to suffer for a long time yet, as are the public going to suffer for a long time yet. People are not going to be able to meet their partners and their families in other parts of the country, and families, members in care homes, unless we get these numbers down. And so the solution is to get the numbers down, and that may be to get boots on the ground, or it may be to have a national system. But the outcome is the numbers have to come down before we can return to normality. And Councillor Carter's amendment attempts to do that. And so I would urge the administration to take that on board and accept it and move on and do the best we can for our communities. I would just also, Lord Mayor, like to thank my volunteers, and particularly AFSED, who have acted as my volunteer hub, for the sterling work they have done since March. Thank you very much, Lord Mayor.
Thank you. Councillor Khan.
Thank you, Lord Mayor. Can I also take the opportunity to thank Councillor Blake and the council staff and the volunteers. COVID-19 has highlighted the importance of social care, and we are rightly seeing the celebration care workers. Thank you what you do. Now it is time for the government to invest in the sector to ensure we are able to provide care for those who need it now, are better able to cope during the rest of the pandemic and the future virus outbreaks, and to make the sector more resilient and sustainable in the long term. There is a clear cross-party support for this. Jeremy Hunt, the Health Social Care Select Committee, has advised the government that an additional £7 billion per year is needed to be appropriately fund social care, so that we can look after vulnerable people with dignity, respect they deserve. Oxford's Conservative Council leader, Ian Hutsworth, through the LGA, has warned that significant extra funding is needed to shore up social care ahead of the winter with both flu and COVID-19, on top of dealing with existing challenges and as move towards future reform. He warned that the local authority needs long-term financial certainty and asked Boris Johnson to make good on his promise to find solution to social care within his first 100 days in office. There needs to be a fair pay and care paths for social care staff to enable social care to compete with the other sectors in recruitment. There are simply too many vacancies out there with high staff turnover. And as a society, we need to make the role more attractive, especially with the amount of people requiring care expected to rise. Sadly, the knock-on effect of COVID-19 have left the council with funding gap of 95.1 million. Unfortunately, despite their assurance that we would receive financial support, we have not received as much as we need from Westminster. Sadly, this leaves us having to make difficult decisions with our budget. However, this could be avoided with the government making good on their promises, both to reimburse us for extra cost of the pandemic and for Boris Johnson to bring forward his government's green paper with solution to reform social care. Thank you, Lord Mayor.
Councillor Blake to sum up.
Thank you, Lord Mayor. Can I just start summing up by thanking all of you for recognising the extraordinary activity from across the council in keeping everyone informed, and all of you know just how much effort has gone into that, and to suggest that information hasn't been disseminated to people, passed on as soon as it's been available to us, I think is really undermining the extraordinary work that people have been doing. We've had email updates almost on a daily basis. We've had member briefings. We've got more in the diary for next week. We've got the Leeds Outbreak Board, which, as Councillor Carter says, he is a member of, and that is our way that came down from government, actually, telling us that we needed a leader-led board with partners in the city to make sure that we can have a one city response. And it isn't just a briefing session, it's people coming to the table to tell us exactly what they're doing and to learn into how we can work together more effectively. We've set up the Member Outbreak Board as a response to concerns from the smaller groups in terms of coming together. We're not going to accept the amendment today, but I'm quite happy to talk to you to find out why you are dissatisfied with the workings of that group and how it can work better. One thing you have failed to even consider today is the way that this council works with the decision-making process. The fact that we've taken papers to our executive board meetings every single time, going through the fine detail of what this means. But one of the assumptions that you seem to make is that we get information from government with time to consult, with time to go out and make decisions as we choose how to do. I'm afraid, as we've seen throughout the pandemic, this is not the way it works. We get information from government, sometimes through the media, not briefed by the politicians, but leaks in the media. And then we have to try and make sense of it. And all of those people that we've mentioned today have responded so magnificently, end up getting guidance at the last minute, trying to run around and make sense of what it is that government is actually asking them to do. But do you know what? I do not think the people of Leeds would appreciate us having all this time to talk about the impact of the pandemic on their lives, on their loved ones, on their futures, by talking about the internal workings of this council. Let's do that in the appropriate place. This is the space that we come together and talk about the impact on our people. And thank you for all of the really felt work that you've done. But let's look at the Northern Health Science Alliance paper today, talking about the impact on the North, the disproportionate impact because of austerity, because of health inequalities, and because of what we've suffered over the last 10 years. These are the things that we have to talk about, address as a city, and make sure that we're prepared to be able to respond in the best way we can to the way that the pandemic is working and how we can get through to the other side. Thank you, Lord Mayor.
Thank you. We'll now go to the vote. For members' information, as I did at previous meetings, I'm going to invite whips to vote on the behalf of their groups. If any members wishes to cast their vote differently, please let me know, and when your whips finish. If a recorded vote is requested in accordance with CPR 16.41, propose to manage the vote in the same way as how a member vote will be recorded. So can I call on Councillor Dawson? Are you for, against, or abstain?
For the amendment, in the name of
Councillor Dawson, I'll go to the amendment in the name of Councillor Carter.
The Labour Group vote against, Lord Mayor.
So sorry. Councillor Cowan.
Conservative Group vote in favour, my Lord Mayor.
Councillor Campbell.
Abstain, Lord Mayor.
Councillor Hutchinson.
The MBI Group vote in favour, my Lord Mayor.
Councillor Field.
For, Lord Mayor.
Councillor Anne Blackbrown.
For, Lord Mayor.
Thank you. That's been lost. I'll now go for the vote in the name of Councillor Blake. Councillor Dawson, are you for, against, or abstain?
The Labour Group are for, Lord Mayor.
Councillor Cowan, for, against, or abstain?
For, Lord Mayor.
Councillor Campbell, are you for, against, or abstain?
The Democrat Group are for, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
The MBI Group are for the, thank you, my Lord Mayor.
Councillor Field, are you for, against, or abstain?
For, Lord Mayor.
Councillor Anne Blackburn, are you for, against, or abstain?
For, Lord Mayor.
Thank you. That's been carried. Thank you. We'll now go to item 7, report and cooperate. Councillor Scope.
Thank you, my Lord Mayor. I'm delighted to move this report, which highlights the important work that we're doing as a committee. I feel really privileged to chair this committee. The committee provides robust challenge on the governance, audit and risk arrangements of the council and champions democratic oversight of the governance arrangements. Leeds City Council has a long established record of good governance and sound financial management, and the importance now when the council is under such financial pressure is as high as ever. I'd like to share some of the highlights in terms of the value added over the year to the end of March just gone, and they include but are not limited to a lot of work around social value in procurement. The committee has sought to ensure that the processes used in procurement reflect the council's desire to recognise social value in those contracts, and I'm really hopeful that we'll see those things being reflected more in contracts that are signed in the future. Whilst a little dry, I'd be remiss not to mention the committee's work around the public service network, or PSN compliance, which means that we can share data with certain other governmental organisations, and that's essential to a lot of the work we do. The role the committee has taken in providing oversight, requiring senior officers to take further actions, we've taken that responsibility very seriously, and we've moved the project on. And that's reducing risk to the council. I'm also very pleased that we have ensured that the council has tightened arrangements for directors when declaring gifts and hospitality. I'd also like to take this opportunity to thank each and every member of the committee, working very much on a cross-party basis to provide a robust challenge to the governance arrangements of this council. I believe that this is something every single member of this virtual chamber can support. I'd also like to thank officers who support the committee. In particular, Kate Sadler and John Greaves. Your time, energy and commitment to the committee and its work programme is much appreciated and valuable. Since the last time Council considered the work of this committee, a new head of internal audit has been recruited, and so I'd like to welcome Louise Booth to the role and to Leeds. I look forward to continuing to work with you. I'm sure with the pandemic, your role looks different to what you expected, but the work you and your team do is vital to the good governance of this council. I'd also like to thank Jonathan Foster for stepping up as interim head of internal audit while we were recruiting Louise. Thank you, my Lord Mayor.
Councillor Gardner.
Thank you. Happy to second, Lord Mayor. I'd just like to say thank you to Councillor Scopes for his taking of the chair this last year after the sterling work done by Councillor Ritchie before him. I'm really pleased we have a layperson to come onto the committee as per national guidelines for such committees. Really important to make sure the internal workings of the council works as it should, dovetailing with scrutiny boards, of course. And as Councillor Scope said, you know, politics are left at the door in what in our house is termed the nerd committee. Don't know if the other members would agree with that. And you know, judging by the discussion a bit earlier on in this council meeting, and as Councillor Blake said, the internal workings of the council need to be discussed in the appropriate forum, and that's exactly what Corporate Governance and Audit Committee is for. And really important the next year that we are on the ball with all that we do each and every year. Thank you.
Councillor Robbins. Taylor.
Thank you, Lord Mayor. Just a few words from my perspective of the Nerd Committee, if I may. Firstly, and I'm sure on behalf of all those of the committee who aren't down to speak, a thank you to Councillor Scopes, who we think has chaired the committee well since being appointed, and has steered us through a range of complex matters that have come before us. At first glance, the remit of the committee is not the stuff of headlines, but the work it does is no less vital to the success of the council. We're concerned, amongst other things, with good governance and how we can strengthen our risk management and internal control arrangements, the accounts and audit processes, and performance management. We've received reports on everything from financial management, procurement and business continuity, audits of schools, SIL, and decision-making arrangements, including for planning, as well as much more. As we potentially move to new arrangements under the planning system, under the proposed changes from the government, it is possible that a new infrastructure levy will be introduced. I think there are a number of issues with how SIL is working at the moment and whether it is providing maximum value to local communities impacted by development. If a new system is introduced, I hope the committee will be able to take a look at how it can operate most effectively here in Leeds. Now more than ever, as so much of the council's work and processes have moved online, and with so many members and officers working remotely, we must continue to ask the right questions about our arrangements. Are we working effectively? Are we working transparently? Are our decision-making arrangements robust in this new environment? The pandemic has forced us to change the way we work in so many ways, but we must remain vigilant and steadfast in our commitment to the goals of good governance and sound financial management. I look forward to continue to contribute to the work of the committee going forward. Thank you, Lord Mayor.
Councillor Robinson.
Thank you, Lord Mayor. Often we find that the real decisions are buried away in committees that don't have the sexiest of titles and those that control the purse strings. And perhaps this is just one of those committees. Looking at Treasury management, IT projects, it has a huge impact for the council. And I fully agree with what was said by Councillor Scopes and Councillor Garner, which about the internal workings of the council being discussed in the right forum. And I think that where those internal workings impact the frontline services of the council, that's where this marries up. There is potentially a huge amount of savings that can be made with contracts, tendering and procurement. And I was interested to read the report and the previous minutes of the meeting about what was being done there. And I hope that there can be some work done with the Resources Scrutiny Committee to look at this a bit further, given the financial pressures. It was also a good opportunity to ask about the risk register, because I have asked through Scrutiny Committee about this, that the COVID report notes it, that COVID has been classed as a major incident. I think it's time that when we look at our risk register, that the pandemic and lockdown measures are a measure of their own and are recorded on their own rather than being lumped under a major incident. We know that they're very, very different to other major incidents, far longer lasting and have a far greater impact. And it would be right to consider that in the future. I thank the council for their time and look forward to the response. Thank you, Lord Mayor.
Councillor Bentley.
Sorry, Lord Mayor. Thank you, Lord Mayor. I'd like to support this report and really a repetition of some of the issues that have already been raised. I've been on this this committee ever since I was a councillor for the last 8 years, and you know, I've seen chairs come and I've seen them go, and they all bring their own particular style. And Councillor Scopes, in his tenure so far, has been an excellent chair. He's measured, he's thoughtful, but also very incisive. He doesn't let much get past him, and we are all grateful for that. The report does show the wide range of issues that we we deal with on this committee. Sorry, Lord Mayor. That's £5 for your fund, I think, Lord Mayor. My phone's just gone off.
I think it's £10, Councillor Bentley.
£10, okay, £10, Lord Mayor. It'll be in the post. Check in the post. So they're as someone says, not the most glamorous of things, but it is about the glue and the lubrication that keeps the city council moving, that we're so involved with. One of the key challenges we've had in the past was to try to make sure that our business continuity and our emergency procedures were kept up to date and people took them seriously and kept them up to date. And that wasn't always the easiest of tasks, but how thankful we are with our perseverance on that in light of all the events over the last 10 months, as the council has had to operate in different ways, have different contingencies, and been able to draw on that. And we feel rightly pleased that we did persevere in making sure that those continuity plans and contingency plans were in place throughout the council. So just to add my thanks again to everyone in the committee, and to welcome the new officers that are now serving the committee, and a particular thanks to Andy Hodson and Sonia MacDonald, who was the previous audit manager, who have now moved on from the committee, but thank them very much for the great value that they added to our deliberations. Thank you, Lord Mayor.
Thank you. Councillor Scope.
Thank you very much, my Lord Mayor. I'd like to start by associating myself with what Councillor Bentley said at the end in terms of thanks to Andy Hodson and Sonia as well, and obviously Kevin Ritchie, who was chair before me. I'd also like to thank the committee members for the kind words. And I'd just like to comment on, in terms of the risk register and the COVID being a specific threat. I think a lot of the work on COVID has happened post the year end that this report is written on, and so clearly next year there'll be a lot more detail about the work we have done, but I recognise we do need to take that very seriously. Not least, we've looked at in this year, and I guess I'll talk about it again next year, in terms of how decisions are signed off, who's signing them off, how delegated authority works with that, and there's been work done in terms of the forms behind the scenes, and I think there's also work to be done and more work to be done. Work has been done and more work to be done in terms of the exact scope of the committee relative to the scrutiny boards, and I think there is an overlap, but we need to make sure that our roles are clearly defined and be able to refer things from my committee to scrutiny. And there was a time last year where we referred some of the directorial risks on the risk register to scrutiny boards to look at, and the Corporate Governance Audit Board looked at the corporate risks that spread across the whole council. And we just need to make sure that each of these committees does their role in the appropriate way. And I'm very happy to talk to anyone who's interested in the scope of the committee and the terms of reference. And with that, I'll thank everyone for taking part in this debate. Thank you, my Lord Mayor.
Thank you. I'll now call for a vote. I'll now ask members to vote in respect of recommendation of this item. Silence, I'll take that for a yes. So can I ask members? I'll take that for a yes. We'll now move to exec meetings, and which will last no more than 30 minutes. Councillor Buckley.
Yes, thank you, Lord Mayor. And notwithstanding her previous remarks, actually, could the executive member for Climate Change, Transport and Sustainable Development comment on whether she thinks schemes commissioned by the council under the Emergency Active Travel Fund and other cycling and walking programmes are providing value for money and not creating possibly more problems than they solve?
Councillor Mulherin.
Thank you, Lord Mayor. Councillor Buckley, I'll just go over some of the stuff I mentioned earlier. We've installed a number of schemes using the government's Emergency Active Travel Fund. These are generally being received very well and got positive feedback from residents and users alike. The measures range from widening of footways to enable social distancing, protecting cycle lanes, school streets initiatives and active travel neighbourhoods, which are just beginning this week. These low-cost schemes are good value for money, and the majority of the benefits are achieved for about a fifth of the cost of traditional construction methods. The school streets have already allowed pick-up and drop-off time for parents and children to be conducted more safely at 14 primary schools across the city. Very positive feedback has been received in most cases, and parents and staff have told us that they really appreciate the difference they're making to the start and end of the school day. Requests for other school streets have already been received and will be looked at in any future rollout that we can fund. Installation of lights segregation for cyclists in the form of ones and orcas on the A65 and A660 provide a safe, protected cycling space for those using bikes, particularly those who got back on their bikes during the previous lockdown and were therefore more confident in using the roads because of the protection that the ones and orcas provide. And our active travel neighbourhoods, which have been developed in collaboration with ward members, the first one installed in Hyde Park this week, with Chapeltown soon to follow, and final amendments being agreed locally with ward members to the scheme in Beeston. Because of the demanding timescales set by the Department for Transport, these schemes are being introduced as trials to ensure that our residents have the opportunity to feed back their views before any permanent changes are introduced. We have removed some measures following local feedback, for instance, the social distancing measures on streets in Wetherby, and continue to work through issues in other locations as they are raised. Not only do they respond to the COVID pandemic, they're also aligned with our long-term transport strategy to encourage walking and cycling, to tackle a climate emergency, to become a city where you don't need to use a car for your mobility needs, and to improve the health and well-being of Leeds residents. We've got ambitious plans for extending our cycle network, as you know, across the city, and it's pleasing to note that the significant permanent works that are taking place in the city centre as part of the Lip Tip scheme, the Outer Ring Road Cycle Superhighway, and the City Connects 2 and 3 projects, after considerable development work and public engagement, are now well underway. We're awaiting news, as I said earlier, for the second allocation of the government's emergency active travel funding. That was expected in August, and we will make it will make delivery of those schemes very challenging if the announcements continues to be delayed and the original timescales that the government were requiring for that scheme to be introduced remain the same. So I'm hoping that in the discussions that are taking place today, we'll get a sensible approach to enable us to deliver those schemes over a longer time frame.
Is there a supplementary, Councillor Buckley?
Yes, please, Lord Mayor. And many of the objectives which Councillor Mulherin refers to in her answer, a brief and concise answer, are absolutely shared by all of us. I don't think we'd have any particular objections to many of the objectives that she outlined. But would she specifically address herself to one of the problems or two of the problems? Firstly, traffic held up in bottlenecks, which is therefore going to potentially cause more pollution problems than it actually gets rid of. And specifically in connection with the scheme on Claypit Lane, and no doubt other schemes where lanes are actually being narrowed. So the number of lanes for traffic is the same, but they are being narrowed. And is there not a potential problem, as there has been in other areas of the country, where emergency vehicles have found it impossible to get through because traffic physically cannot get out of the way?
Thank you. It's always interesting to see what the follow-up question is going to be. And of course, as the exec member, you're left wondering what angle the questioner is going to take. So in terms of the traffic in bottlenecks that you're referring to, the Claypit Lane scheme is one of the City Connect schemes. It's creating permanent segregated cycle provision from the city centre to link up both with the Chapeltown scheme and the Meanwood Road scheme that we already have in place. That enables those communities to safely access the city centre and vice versa on cycle routes that are off the main road, making it much safer for those active travel users. As you note, the scheme is designed not to remove road lanes, but to narrow them. Now, part of the government's own requirements for the Emergency Active Travel Fund was actually to take road space to give to cyclists and to pedestrians. So there's a little bit of conflict there, I think, really, with what your own government is asking us to do. I would say that ensuring that there are safe routes for those more vulnerable road users is absolutely the right way to go. And in terms of emergency vehicles, I'm not aware of the examples you're referring to, and it would probably be helpful if you want to forward them to me, of emergency vehicles not being able to get round the congestion that you're referring to. The congestion on Claypit Lane is usually in relation to the traffic lights. There are a number of lanes. It's a busy, very busy arterial route in and out of the city centre. I'm not aware of any incidents that have taken place with emergency vehicles not being able to get through on there. But if you do have examples, please do pass them on to me and we can liaise with our partners in the emergency services to find out what's happened there.
Councillor Galton.
Thank you, Lord Mayor. Can the Executive Member for Children's Services tell us if she is satisfied that the Healthy Holidays Scheme commissioned by the Council allows equitable access for children in need across the city?
Councillor Venner.
Thank you, Lord Mayor. Thank you, Councillor Galton. It's thanks to a great deal of hard work from all involved that the Healthy Holidays programme has continued to reach as many people as possible, as many children as possible, in the face of record levels of demand and rising child poverty, which has been exacerbated by the pandemic. It is limited funding, and this dictates that it is directed to the areas of greatest need. To be really clear, the Healthy Holidays programme is a targeted scheme aimed at children who are living in the postcodes and areas of highest deprivation. This is the right thing to do. We know that of highest deprivation are likely to have a wide variety of challenges, and also that they have the highest child populations in the city. As a result, the resources that are available are used to best effect, and I am very proud that the Leeds Healthy Holidays programme, delivered by Leeds Community Foundation, continues to provide food and activities for some of the most vulnerable children in Leeds. Thank you.
Is there a supplementary, Councillor Galton?
Yes, thanks, Lord Mayor. In recognition that not all families in greatest need live in the areas with the greatest need, will the Executive Member please commit to carrying forward an exercise in partnership with the Community Foundation to try to widen the schemes that are delivered through Healthy Holidays programme in some of those areas which are not yet covered, especially given the as yet unspecified extra resources that the government is apparently promising the local authority to deal with child food poverty.
Councillor Bennett.
Thank you for the supplementary question. In my response, I'm going to outline how the funding is allocated and the evidence that is used to make those decisions. And then I'm going to talk about what you could do, Councillor Galton, if you wanted to attract funding for a scheme in your area. So the Healthy Holidays programme has been running for 3 years. It provides food and activities to some of the most vulnerable children in the city. Run by Leeds Community Foundation, the scheme partners with Leeds City Council, community hubs, schools, third sector organisations, private sector organisation and philanthropic donors. The application process for funding is led by Leeds Community Foundation, who convene an independent panel to make those decisions. And they work closely with officers from the council to ensure that all schools and organisations are informed about the application process. As I've said, because the funding is limited, Healthy Holidays is concentrated in and around neighbourhoods that have the greatest level of need. So the last tranche of money that we gave out, which was only just over £100,000 that was left over from the Department for Education grant, we thought at the time had to stretch over not only the October half term, but Christmas and the February half term as well. Councillor Galton, in your supplementary, you referred to, will we carry out an exercise? Actually, the decisions are already backed up by a huge amount of evidence, mainly generated by Leeds Observatory. So in allocating funding, the panel took into account a number of different factors, and these included levels of deprivation, levels of free school meal access to schools, targeted vulnerable groups such as refugees and asylum seekers, the range of activities and food proposed by the applicant, and the number of days provided and the number of children that they could reach. They also prioritised third sector organisations, schools and community hubs in priority locations that had demonstrated good take-up previously and had the ability to deliver provision that could be modified for COVID-19 safety guidance. So not only did the money go to areas of highest deprivation, but also to organisations that had a previous track record of good take-up of healthy holiday schemes. Now, because it's limited funding, it is right that it goes to the areas of highest deprivation that, as I said, also have the highest child populations. But of course, there are pockets of deprivation in areas that aren't deprived. And over the past 2 years, several schools with below average free school meal eligibility, who are not based in the areas of highest deprivation, have submitted a funding bid as part of a consortium of schools based in more deprived areas, and some of these bids have been successful. And it's likely that that will also be an option for school applications next year. Also, Leeds Community Foundation have committed to help search for match funding if community committee areas want to commit some of your resources for food and activities. So Councillor Galton, there are various routes available if people want to apply for schemes and they're not in priority areas. Yeah. In line with our child-friendly ambitions, we would very much like for all children across the city to be lifted out of food poverty. And we continue to do all we can to support children and families in need. Councillor Galton's question does highlight the lack of city-wide provision and once again demonstrates why free school meals should be available more widely and why we've supported the phenomenal campaigns led by Marcus Rashford to extend free school meal provision over the holidays. In the absence of government support over half term, our city responded magnificently to the challenge of child food poverty, not least through the support and donations that were given to the Healthy Holidays programme. But protecting children from hunger should not be left to the kindness of individuals, and more people are now recognising the value of our social security system and that it needs to do more so that families are not in food poverty. The moral leadership that our government has lacked, but that footballer Marcus Rashford has shown not once but twice in forcing the government to U-turn over child poverty, has been truly commendable. We continue to back him in his third goal, which is to widen the national provision of free school meals and to increase the value of Healthy Start vouchers. Hopefully he will achieve this hat-trick because this would represent a more sustained and comprehensive approach to tackling child food poverty. Thank you. Thank you, Lord Mayor.
Councillor Lennox.
Thank you, Lord Mayor. Can the executive member comment on the most recent unemployment figures for Leeds?
Councillor Pryor.
Thank you, Lord Mayor. So the provisional figures from the DWP published this week for the total number of people claiming universal credit in the Leeds local authority area is 70,127. And this includes all universal credit claimants, whether they are in employment or not in employment. And this is an increase of a staggering 98% since March, and an increase of 1,135 claimants on the previous month. The revised figures for the number of people claiming universal credit in Leeds who are unemployed in September 2020 is 42,884. And this is an increase of 81% since March 2020 and an increase of 102 on the previous month. And I really want to highlight that these figures are always a month behind, so are accurate as of the 10th of October. So will not take into account redundancies made in anticipation of the end of, or the original planned end of the furlough scheme on the 31st of October, which obviously has now been extended to March, nor will it take into account the impact of the latest national restrictions. So 16 to 24-year-olds make up 20% of these claimants. Those under the age of 35 make up 52% of all claimants. So we know that in Leeds we are seeing three broad areas of the workforce requiring different levels of support. So we have the newly unemployed, the new entrants to the labour market who are typically school, college and university leavers, and the long-term unemployed and those not in education, employment or training. So we need to continue to work to creating more secure, well-paid jobs that are less vulnerable to changes in the labour market. Much of this work is already underway through a well-established Employment Hub programme. The Employment Hub pulls together a number of ESIF-funded programmes aimed at supporting any resident who's age 15 and above, who's unemployed or inactive, including those who are at risk at becoming NEET. The long-term unemployed and individuals from groups which face a particular labour market disadvantage to tackle the barriers to sustainable employment. So since March, we've been working with partners to increase capacity across our programmes, adapting and expanding our training and reskilling programmes to reflect those changes to the labour market and pivoting to where new jobs will be created. And I am pleased to say that since March, we have helped over 1,500 people into employment, with an additional 1,700 currently being supported. Now, usually kind of these are kind of good figures that we're helping, but obviously what we're seeing is a tide of unemployment hitting the city at the moment and hitting the country. But I do want to point out that there are gaps in the support available from the government for the self-employed and people who don't qualify for the self-employment income support scheme. These do include people who work for themselves as limited company directors, they include freelancers, and they also include the recently self-employed. Now, it's described as recently self-employed, but recently here can mean over a year self-employed who just won't qualify for a reasonable amount of pay from the government. And estimates are that around 1 million people were ineligible for furlough because they were short-term contractors moving between jobs or small company directors who draw most of their earnings in the form of dividends. And up to 2 million people didn't qualify for the self-employment income support scheme, either because less than half of their recent income was from self-employment, they became self-employed too recently to have the necessary tax records, or actually for a small minority was their income exceeded a certain limit. And this just shows that there are people who the government's kind of one-size-fits-all approach on support for self-employed people just isn't working. So thank you, Councillor Lennox, for the question.
Is there a supplementary, Councillor Lennox?
I do have a supplementary, yes, thank you. It's really sad to hear that the numbers of people claiming universal credit in Leeds have increased to such an extent. What does the executive member think that the last-minute announcement of the extension to furlough will contribute to this?
Councillor Pryor?
Thank you, Councillor Lennox. Yeah, so the last-minute extension of the furlough scheme will have directly led to people losing their jobs, which they otherwise may not have done. And actually, I think it shows a real contempt for people across the country and here in Leeds. Employees are faced with a constantly changing situation with a revised job support scheme offering different levels of support based on which tier they fell into. And then once they understand what that set of rules meant for them and their employees, they were then faced with a national lockdown. I think it's important to note that Leeds has had 4 different sets of rules within a 6-week period, and that is causing havoc in a lot of businesses with their employees. But not only that, and at the same time, literally hours before the coronavirus job retention scheme was due to end, it was announced it would be extended till December the 2nd, when the current lockdown is due to end. And then again, yet another change when the Chancellor announced furlough would continue till the end of March next year, and the job retention bonus had been scrapped with no date in sight for it to be reinstated. Now, I'm not denying that furlough is a good scheme and that the government was right to extend it, but what's deplorable is the constant last minute chopping and changing, meaning businesses can't effectively plan for their future. And that's led to many staff being made redundant, when now it seems they could have been spared that. Were people to be made redundant because they couldn't have been supported without the furlough scheme, redundancy notices would have gone out 4 to 6 weeks before the end of furlough. Announcing an extension of furlough hours before it was due to end will have done absolutely nothing for these people. Labour were calling on the government to extend the furlough scheme at this time for precisely this reason. It was entirely predictable, and the government's inability to plan ahead has literally cost people's jobs and livelihoods. And I personally just think this is unforgivable. They're going to be plunging more people into poverty who face an uncertain future, worry how to pay their bills, and actually they'll have a truly bleak Christmas. And this was all totally unnecessary. We know that as a council, we need time to plan our finances. We tell government this all the time. We also know how much notice needs to be given to people if you are going to make them redundant. Government knew this too, and yet they waited until literally the 11th hour to put a scheme in place that could have saved jobs. I mean, for how much longer are we going to have to watch as the Conservatives kind of govern on the hoof at legislation decided by leaks and U-turns? And frankly, I don't know how anyone can have any confidence that they actually know what they're going to be doing next. Thanks, Lord Mayor.
Councillor Field.
Thank you, Lord Mayor. Can the Executive Member for Health, Wellbeing and Adults ensure that going forward, where there is a significant COVID-19 outbreak, elected members and the public can expect a high degree of transparency from Leeds City Council?
Councillor Charwood.
Thank you, Councillor Field, for the question and for the request that going forward there's transparency to a high degree. I think where we would perhaps differ is that I think we have had a high degree of transparency so far, albeit within a very challenging set of circumstances. So, you know, as was covered in the debate earlier, we have been dealing with a very fast-moving pandemic, which has, involved many national bodies such as Public Health England, the governmental bodies, ourselves, decisions happening and information coming down that's not in our control, and we've had to act quickly to engage members. And the debate earlier about engaging members in decision making sort of applies here as well. We've given COVID information, obviously, through regular executive board reports and regular updates to councillors, MPs, partners, staff and unions. And people have, members have, really appreciated getting the daily, mostly daily updates from Councillor Blake and Mariana about, what's happening and what we're doing in the city. It's included extensive information about infection rates, outbreaks and other relevant indicators, including links to publicly available local data. And local ward members have been notified of outbreaks in settings, including schools and workplaces, as well as being involved in local meetings when infection rates are high. And ward level data has more recently been shared with councillors to sort of supplement the more localised information that's already available. And individual member inquiries have been answered, but clearly there's a balance to be struck between providing highly localised and up-to-date information quickly with elected members and the public, and protecting individuals and their confidentiality, but also raising alarm in the local community or causing panic. We've tried to take a very measured approach in that, but I'm not saying we've done it in every case. We've managed to get information out in a way we would like. There's been factors affecting that in many cases which are not in our control, and I think officers have done a remarkable job in getting out the information using this measured approach, taking these sorts of decisions in a really responsible way
to support our communities going through this really challenging time. But has it been perfect? No, because everybody has been said many times by ourselves in this chamber and nationally, you know, nobody gets everything right in this sort of pandemic. But I'm really proud of the work we've done in terms of transparency so far, and happy to discuss with you anything you might need for your local ward and other members as well going forward.
Yes, supplementary, Councillor Flynn.
Yes, Lord Mayor. Can I ask the executive member if she thinks it's acceptable when there is a major outbreak of 89 positive cases from a single source, that it took 17 days and then only following intervention by the Member of Parliament for local members to be given a proper briefing?
Okay, well, that's not my understanding of the situation. In this instance, you had the full briefing was organised for local councillors and the MP as soon as it was practical to do so, but also members were notified as soon as Public Health England informed the council and initial information had been gathered. We did have environmental health officers working closely with the college to enable them to open safely and ensuring all identified COVID safe measures had been implemented. And following this, a further communication was sent out to local members and a verbal briefing was held to update councillors. So my understanding is that it wasn't 17 days from us having the information at hand. But, you know, again, going back to my earlier sort of responses, we would rather have a more ideal situation and set of circumstances. There has been delays in information coming down to us from national bodies who obviously have been stretched as well. But you know, we would like to get ward members appraised of the situation as soon as is practical. And I'm informed that that did happen as soon as it was practical to do so.
Councillor Arif.
Thank you, Lord Mayor. What work is being done in Leeds to support children with additional needs and their families?
Councillor Venner.
Thank you, Lord Mayor. The challenge for all our children and families during the COVID pandemic has been immense, but thank you, Councillor Arif, for the opportunity to highlight the particular impact on children with additional needs and their families, some of whom have been in contact with me over the past 8 months, either directly or through organisations that support them like SNAPS and YCAN. And indeed, immediately before this meeting, I was on a Zoom call with parents from Carers Leeds who are supporting children with additional needs. In Leeds, we recognise that these families have really struggled without the usual forms of support provided by schools and face-to-face services, and also not being able to access the help that they usually would from friendship groups and extended families. And we've worked hard to adapt our support for them. The last 8 months have placed a terrible strain on people who often feel isolated and lacking in the support they need anyway. Save the Children reports that more than a third of low-income families have been forced to rely on help from charities for food and clothes, and that 60% have gone into debt. Children are the principal victims of this, especially children with disabilities, and in fact all those who really rely on support outside the home, support which in many cases has been limited by lockdown and social distancing restrictions. The Disabled Children's Partnership have reported families feeling locked out and abandoned by the government and by society, and of being fearful for their own physical and mental health. Indeed, some of the families who've contacted me have in theory had access to support, but felt unable to access this because they've been so fearful about their clinically vulnerable children coming into contact with other people who may be able to provide support. So in Leeds, our outstanding children's services have worked hard to keep in contact with families, to reach out through partners and through parent and carer groups to people who may not previously have been in receipt of services. And we've adapted our services to be in line with the restrictions of the pandemic. That has meant some support is being provided virtually, and a full directory of support services available can be found on the Leeds Local Offer website. Where families have struggled because of ill health or children not being in school, increased individual support worker packages have been put in place. The occupational therapy team have continued to support families, and short breaks have continued to be provided, though unfortunately some of those have had to be reduced because of the lack of availability of space for social distancing. So in response to this, wherever possible, short breaks have been provided at the council's amazing outstanding rated Rainbow House, which has not only continued to operate, but has offered additional day support for at-risk young people who've not been able to access other schemes. In addition, requests have been supported for increased direct payment packages, provision of personal budgets for families to buy things like outdoor equipment that they can use at home. Social workers have continued to make visits wearing PPE if needed or keeping to social distance. Where families have been too anxious for visits, social workers have made Skype calls, they've used Zoom, they've used FaceTime, and some families and children and young people have responded well to that. Some have found it an easier way to communicate, but we also do very much recognise the limitations of this. Council colleagues should know that as we endure a further period of lockdown, it's really important that if a family in Leeds is struggling and isolated and is registered with a school, that they contact the school and they will coordinate the office between the early help team or cluster and wider services. And if a family are home educating their child, the elective home education team can offer some support in directing them to services. In Leeds, we've done all we can to navigate and continue to prepare for the colossal challenges that the COVID-19 crisis faces. Our children's services have worked hard to assess risk and to coordinate our response with 2 weekly meetings that have brought together the Silk schools, the Silk cluster, commissioning, health partners, the police, hubs, and the Child Health and Disability Service. But I really fear that the long-term impact of COVID-19 will serve to exacerbate difficulties that children and their families already face, especially children with additional needs. The government's broken promises to compensate local authorities for the costs of the COVID-19 crisis have placed a great strain on children's services across the country, which have already been severely cut over the last decade of austerity. This means that essential frontline services that many children and families rely on in Leeds are once again being squeezed. And just as we've seen it, only with so much passionate campaigning did the government agree to feed hungry children over Christmas. They have consistently and continuously demonstrated flawed priorities. Council, the government must properly resource local authorities to deliver effective and responsive services that are needed to keep all our children and young people safe and well. The disproportionate impact of COVID-19 on children with additional needs will be a challenge that we will face as a city for many years to come. And we will continue to work tirelessly to make sure that children with additional needs and all children in our child-friendly city can achieve their full potential. Thank you, Lord Mayor.
Yes, supplementary, Councillor Arif.
No, Lord Mayor.
Thank you. That's the end of the question. For those that haven't been answered, you'll have a written answer. We'll now move to item 9, minutes of health and wellbeing. Councillor Blake.
I move in terms of the notice, Lord Mayor.
Councillor Dawson.
Second, Lord Mayor.
Councillor Carlyle.
Thank you, Lord Mayor. I want to welcome the updated dementia strategy from these minutes and celebrate the progress that's been made over the last 7 years. Our ambition is for Leeds to be the best city to live with dementia, where people and carers are included in social, community and economic life and supported by services which work well together. The Alzheimer's Society estimates that people living with dementia make up 25% of acute hospital inpatients and 80% of people living in care homes. There is therefore huge potential for investment to delay or reduce uptake of high-cost services by promoting well-being and, where appropriate, avoiding admissions. The strategy highlights some key achievements, including how over 130 Leeds residents are Dementia Friends champions and have run almost 2,000 awareness sessions, enabling over 30,000 people to become Dementia Friends. The high rates of diagnosis, which enable more people to get the support they need sooner. Identifying health inequalities linked to heart disease and type 2 diabetes as risk factors for developing dementia. Memory support workers established as part of Leeds neighbourhood teams, older people's mental health services and linked to GP practices. The funding of a dementia-friendly Leeds coordinator, helping local people, groups and businesses to develop dementia-friendly and age-friendly approaches. And 47 memory cafes supporting people across Leeds. These community groups have been vitally important, as I saw when I visited the Sunflower Memory Cafe at St John's Church in Farsley in my ward last year and took part in their quiz that certainly did get the brain cells working. Unfortunately, groups like this have had to be suspended at present, but the dementia strategy includes plans to offer support to organisers to establish digital alternatives, identify people who are disconnected from support, and to re-establish safe face-to-face provision when restrictions allow us to do so. Indeed, a large focus of the strategy has had to shift to reset and recovery, but we're well placed to respond to the challenges that COVID-19 has brought. I'm thankful to the adaptability of staff supporting those with dementia, who've responded to the uncertainty over the pandemic by adjusting the way that services are provided. Dementia can be extremely tough and challenging, affecting family and social life, finance, plans for retirement, and much more. However, I believe this strategy contains the right steps we can take to improve the experience of those who suffer from dementia, to support them and their families, despite the challenges we face as a city. Thank you, Lord Mayor.
Councillor Wenham.
Thank you. Thank you, Lord Mayor. I welcome the update on maternity strategy, which put women at the heart of what we do. Leeds has a real strength in our city maternity services, which is a key arm of really an excellent integrated work we do across the partnership with public health, health visitors, children's centres, the third sector, and prenatal mental health services, in a key contributions to achieving the best possible start for every baby in the city. In the National Maternity Survey, Leeds has been rated amongst the top 5 for staff kindness, patient experience, and overall quality of care in the last 2 years. This is particularly powerful as it gathers directly from local women who have used the service. However, we have challenges we need to address. Nationally, we know that there is much to be done. A year ago this month, an Oxford University reported into maternity mortality in the UK found that Black women are 5 times more likely to die in pregnancy, childbirth, or in postpartum period compared to the white counterparts. Asian women are also twice as likely to die compared to white women. Disappointingly, this data was up from previous years, which still shockingly show Black women were 3 times more likely to die than white women. A priority in the strategy is tackling health inequalities. Locally, we know that around 1/3 of all births are in our most deprived areas. It was noted in the health need assessment that data collection, reporting, and sharing needs to be more robust with regards to women with complex needs. This information is crucial to determine gaps in the service provision, especially where needs are being met, share best practice, and ultimately work to reduce health inequalities. The strategy recommends an emphasis on opportunities to promote positive preconceptions where there are issues such as domestic abuse or substance abuse. There is more to done to identify and support women of all backgrounds. Working together with those local communities with great needs. We are hopeful that this local approach, alongside the Government Minister of Equalities, work with midwives, medical experts, and academics to investigate maternal mortality across the country's diverse community. We can continue to improve parents' experience during this maternity. Thank you, Lord Mayor.
Councillor Arrington.
Thank you, Lord Mayor. I'm speaking on minutes 7 to 17, pages 73 to 80 of the Health and Wellbeing Board meeting on the 30th of September. I had the pleasure of attending this meeting as a substitute, but since the conclusion of agenda item 5 of today's meeting, the report on appointments, I'm delighted to now officially be my group's new representative on the board. I would like to say a word of thanks to my predecessor, Councillor Graham Latty, who worked extremely hard on health and wellbeing matters, and I know his contributions to the board will be missed. Turning to the business of the meeting I attended, I must say that I was impressed with the broad range of topics under discussion. These included the maternity strategy, which Councillor Wenham has spoken about, integration and person-centred integrated care. Let's do things with people, not to them. The work of the CCGs, the Carers Partnership Strategy, the Dementia Strategy and other reports. As with other boards, this was a full agenda for a single meeting, and I think we could easily have devoted an entire meeting to each of the reports. As we have seen in the debate on COVID, the impact of the pandemic on all of us has been immense, but it is particularly heartbreaking to consider the experience of people living with dementia in care homes and their families who are separated from them during this time. Councillor Caroline Anderson spoke movingly about this earlier. Visits from relatives have been restricted, and the impact of this lack of contact will be significant on the mental health of many, many people. Despite innovative schemes that have allowed contact digitally, I hope we can quickly get back to a situation where in-person visits are safely possible again, because we know from evidence that contact is key when it comes to this condition. I have a 94-year-old father myself and totally understand this situation. Fortunately, he does not have dementia. It seems to me that part of the work of the Dementia Oversight Board going forward should be to examine ways that we can provide that extra support to people with dementia during and after the pandemic, and I hope this work will take place. I look forward to discussing this and all the other matters within the board's remit at future meetings. Thank you, my Lord Mayor.
Councillor C. Anderson.
Thank you, Lord Mayor. I'm speaking on the Health and Wellbeing Board minutes, minute 12 on page 79, the Living with Dementia in Leeds Strategy 2020 to 2025. The strategy includes the establishment of the Leeds Dementia Oversight Board, which will oversee the implementation of this strategy. I welcome this, but it needs to have teeth and not just be a talking shop. It must seek to ensure the strategy is implemented. It's a big piece of work and has a great deal resting on it. Inequality in health can lead to dementia and all sorts of other conditions, and I'm pleased that this strategy is putting this high on the agenda. As part of my local care partnership group, Holt Park and Woodside, we have just had a big project looking at falls during Falls Week, so I'm pleased to see one of the things identified as a future challenge is NHS investment in frailty, care coordination and social prescribing. We work very hard on our LCP, and it's very interesting to find out from those who are on the ground, as it were, our GPs, our social prescribers, practice managers, how they are working hard to overcome all the challenges of dementia and support the city in its ambition to be a great place for people with dementia to live and be supported. One of the issues that has arisen during the COVID pandemic is that frail and elderly, and the two don't necessarily go together, as there are many reasons for frailty, are suffering from the lack of being able to do as much strength-based exercise as they normally would, which in turn is leading to falls, maybe more than one fall and subsequent hospital admission possibly. Whether that's because they can't get outside as much, or if people don't have a garden, they don't feel they can go outside, especially in this weather, or they can't attend the exercise classes they were going to, or simply a lack of impetus to do things because it has become hard and it's more difficult to do things when you're on your own, not in a group. And motivation is not always easy during these times. I'm so pleased the report contains an acknowledgement that for people with dementia, they do not understand social distancing either, and why we have to socially distance. It's particularly difficult that they cannot have a hug or hold the hand of a loved one or a best friend. I know that my friend, I'll call him Stan, and his wife Nancy, who has dementia, that's not their real names, is having great difficulty trying to help Nancy to understand why she cannot see the people she wants to see, wants to hug and wants to hold hands with. It's very frustrating for him and their friends and family. One friend tells her he has to distance because he might have the plague, and she actually understands that, so they found a way of communicating it.
This strategy is for the next 5 years. So hopefully come next Easter, we'll all be in a more normal existence and our support mechanisms can start fully again. Thank you, Lord Mayor.
Councillor Galton.
Thanks, Lord Mayor. I'd like to speak to minute 7, which talks about correspondence that was received by the Health and Wellbeing Board associated with the Council's active travel neighbourhood schemes. The letter wanted to know what the NHS was going to do to coordinate with the Council to ensure that those people that were benefiting from these active travel neighbourhoods should also use them to have much more active lives and therefore have better well-being overall. One of the things I'd like to point out here is that the active travel neighbourhoods that were mentioned, as with a lot of the council's initiatives, the majority of them are associated with inner city areas, and why not? Because those are areas that suffer some of the worst congestion and traffic behaviour. And only one of them that's mentioned, which is Otley, is in an outer area. However, Lord Mayor, the need for active travel neighbourhoods is citywide, and even if the capital investment is being focused on particular inner city communities, the example that Otley has given, where a town council has taken the lead in getting this on the agenda and enabling communities, this could be one where the council could reach out to some of the other communities and enable asset-based community development to ensure that active travel neighbourhoods, if not able to be implemented immediately because there isn't the capital resource there, could at least be specced up and could at least be developed in terms of engaging with the community to understand what an active travel neighbourhood is and get their ideas about how they can benefit them. Because one of the weaknesses, I think, of the current active travel neighbourhoods is that they are a little bit of a top-down intervention, and the local neighbourhoods themselves might not have actually been engaged sufficiently, which of course prompted the letter from the doctor to the Health and Wellbeing Board. So I suppose the question is, how will the chair of the Health and Wellbeing Board ensure that elected members are able to pursue the possibility for active travel neighbourhoods throughout the city?
Mr. Flynn.
Thank you, Lord Mayor. I'll be speaking today on the Living with Dementia strategy and specifically about the 70 residential and nursing homes registered in Leeds with the CQC to provide dementia care. I spoke last year at Council about the welcome improvement in the quality of care in these homes over the last few years, very welcome indeed, but also highlighted that dementia care had still some way to go, which was acknowledged by the chair of the board at the time. Looking again at the most recent CQC inspection reports of the 31st of October for these homes, some of the results are fairly concerning. I'll try to present a balanced view of this. First of all, I'd like to acknowledge the magnificent work done by everybody involved in the care sector. That's in care homes as well as our own adult social care staff, at no small risk to their own health. So my comments are not intended to be a criticism in any way, shape or form of care home staff or our own adult social care officers, but I think it's important that we do keep very close vigilance on the care of some of our most vulnerable adults, particularly those in homes. In the 25 nursing homes registered to provide dementia care, where inspections have been carried out, almost 2/3 had at least one area identified as requiring improvement. One home was found to be inadequate overall, 7 to require improvement overall, and a further 8 had at least one area requiring improvement. There were also 3 homes with a good inspection report with at least one outstanding area. In the 38 residential homes providing dementia care, CQC found that over 30% had at least one area requiring improvement. 5 had an overall report of requiring improvement. 7 had at least one area requiring improvement. 2 were good with at least one area outstanding, and 1 home was outstanding overall. So some of those results, I think, need fairly close looking at. Bearing in mind that a good marking is the minimum standard required in any social care environment, anything less than a good marking in the CQC is below the standard required. And those are not my words, Lord Mayor, those are the words of the chair of the Leeds Adult Safeguarding Board. Moving on to avoiding unnecessary time in hospital, a particularly important issue at the moment given the COVID pandemic. Adult social care varied 2 home care contracts in January last year. One to cover short stays in hospital, the other to set up an interim home care service. My understanding is that some of the primary and additional framework providers of home care have since changed, and some quite significantly. I asked last year if any audits had been carried out on the outcomes of the arrangements with the patients and their families. None had been taken at that particular point in time. And I wonder, now that we're nearly 2 years into these variations of contracts, whether any audits have taken place. Thank you very much indeed, Lord Mayor.
Councillor Charwood to sum up.
Thank you, Lord Mayor. I'd like to thank all the members of the board and other members in the council for commenting on the Health and Wellbeing Board minutes. As always, as Councillor Harrington said, a real packed agenda. We tried to change the way we operate the meetings so that we get more time on the bigger issues and just note the things that have already been to Health and Wellbeing Board. We just going on the maternity strategy first. We took a really interesting piece on Zoom, and we took a look and heard from the lived experience of people from Black, Asian and minority ethnic ethnicities in the city and their experiences of using maternity services, fathers, mothers, parents in general, and their experiences. And it was really, we went into different small groups on Zoom, and it was a really interesting way of hearing about, the sometimes very, very difficult and challenging experiences that some people have had because of cultural differences, language problems, in terms of understanding both what people were saying to them and also them being able to communicate what they needed from the system. And it is a fact that there are more stillbirths and other, mortality issues for people from Black and minority ethnic backgrounds in maternity, and it is a shocking fact. And I think we have to start by listening to people and their experience and what they feel are their barriers. And as senior executives, not myself, but the other senior executives on the board, I think my role and our role as members is to put the voice of the user and their experience in front of these very senior people who, and then challenging that, having that discussion and say, what can we collectively do to make this better? And I'm really proud actually of the system who have taken health inequalities on together as a challenge, as a system leadership challenge, and really gone with it and really believe in it. So we don't have to actually push them at all. And the CCG have just published their health inequalities action plan and what they want to do. And it's about commissioning services that are tailored and specific and actually work with our deprived communities to improve their health, as well as create more responsive services that are better tailored for them. And so in the end, we want to hold ourselves accountable for how the data then comes back about stillbirths and deaths and these other awful and challenging statistics. We're doing quite a lot around the Black and minority ethnic work as well with mental health, and I'm really proud of that work. So that was excellent. Other members have really picked up on the dementia work, and I'm delighted about that. It's been a horrendous challenge and really upsetting recently about the visiting in care homes, the isolation and confusion and understanding of the reasons for why people can't have visitors, people who have dementia. It's awful. It's been, really upsetting for everyone involved, I think, trying to find a way through that. So, I think we've got a cross city strategy for how to improve services for people with dementia. And we have had a lot of really good outcomes from that work. But it's a citywide strategy, like the carer strategy is, and also the mental health strategy. It's integrated. We're all doing this together. We all want to make a difference for this community. Just on the dementia and the visiting issue, I wrote to the Minister about that, and I did get a response. You know, obviously it's challenging for them to come up with. Okay, Lord Mayor, and just to say there's a pilot ongoing. We really want that pilot for care visiting to hurry up and come out with some conclusions, and hopefully the vaccine will also help in that regard. Thank you.
We'll now move on to resources. Councillor Ritchie.
Thank you, Lord Mayor. It's hugely disappointing that councils will only get a one-year funding settlement for the third year in a row. This makes it incredibly difficult to plan how to provide the local services our communities rely on, which have proved so vital during the pandemic, including public health, adult social care, children's services, homelessness support, and help for those in financial hardship. This is a missed opportunity for the government to draw a line under inefficient short-term budgeting, which leads to higher costs to the public purse, and allow councils to set reliable medium-term financial strategies. Only with sustainable and certain long-term funding can councils protect and improve services and play a leading role in addressing the stark inequalities the pandemic has exposed by developing a green recovery, tackling skills gaps, and rebuilding the economy so that it benefits everyone. Not my words, Lord Mayor, but in fact the words of the Conservative chair of the local government organisation, Councillor Jameson. For me, the times I agree with a Tory are a bit like jockey's legs, few and far between. But I do agree wholeheartedly with Councillor Jameson on this. So what is it about successive Tory chancellors who don't seem to get it? On the back of 10 years of austerity, where local authorities took a massive hit, disproportionately Labour councils, of course, we were struck with the COVID pandemic. Fortunately, the previous Chancellor Javid had declared austerity was over just prior to the general election, conveniently. And reassuringly, in March, the current Chancellor, Sunak, told the country, councils in England will be fully funded for implementing measures to tackle the coronavirus pandemic. However, unlike the other 8 or so U-turns forced on this government, which were welcomed, the U-turn on this commitment is not and is hugely damaging for our communities. This, of course, against a backdrop of ever-rising demand for children's social care and council tax benefit, uncertainty over business rate receipts and other falling income. Councils will be vital to help our local economies, businesses and town centres recover once the spread of COVID-19 is under control, and government needs to realise this. It's the policy of our council under our administration to invest in the short term to save in the long term. For example, neighbourhood networks and addressing childhood obesity. We can only make these investments on a relatively small scale if we have no idea how much money we'll have in future years. So while we'd welcome further one-off funding to bridge the gap caused by the pandemic, we also need certainty over the funding and support we can expect from government over the next few years by agreeing a long-term fair settlement. Ministerial letters of thanks don't pay the bills of the services that our public sector heroes work for and use. The Tory government needs to wake up and realise that the public sector works best when local councils are properly supported and listened to. Fund us properly and we will deliver, Lord Mayor, won't we? Thank you.
Thank you. Councillor Gruen, Caroline Gruen. Councillor Caroline Gruen.
Sorry, Lord Mayor, I was muted, of course. Thank you, Lord Mayor. I'm speaking on the Accelerated Capital Receipt Scheme, and I'd like to raise 3 key themes in relation to that initiative. Firstly, the financial picture. We are living in a time of unparalleled financial challenge in Leeds, and I welcome this scheme as one tool to assist in narrowing the unprecedented cavern between spend and budget that the COVID pandemic has created. We've just said goodbye to many highly valued colleagues who've chosen the route of early retirement, but who nevertheless will leave a huge gap in the level and quality of service the council can offer. And there are many more colleagues who are about to follow that route. This scheme at least gives us an opportunity to retrieve some funding without damaging frontline services further, and in many ways will contribute to greater efficiency. We've retrieved 6.5 million from capital receipts this year, which could rise to 10 million by March 21, and there's 100 million profiled over the next 5 years. Don't get me wrong, I don't believe that this selling off of the family silver should be done without careful judgment and a balance between buildings that provide the flagship of our services and those that have simply become a drain on the council's income. And now, secondly, the importance of a planned and consulted approach to this. In our ward of Bramley, for example, we've had an eye on the council's asset review since its inception. And there were 4 buildings in our ward up for review: 2 community centres, once the heartbeat of the community, our beautiful library, which has a Grade 2 listed interior, and the Bramley Housing Office. So by working with local organisations and people in the community has acquired and regenerated one of the community centres, which is now no longer costing the council money and is once more providing a wide range of community activities. And we are in the process of doing the same with the second. I'd like to thank Bramley Elderly Action and our local resident and community activist, Mr. Steve McBarron, for these recent transformations and the leading role that they have played in them. The library has been transformed into a beautiful hub, thank you, Councillor Cooper, and now accommodates the housing service and many other frontline services, which leaves the housing office now redundant. Not a building that anyone, including those working in it, particularly loved. There are organisations who'd like to make use of it, but it's on balance, it's probably one we can live without, and many in Bramley would benefit, for example, if the site came forward for affordable housing. And finally, and at least as important as the first 2, if not more so, the imperative to address climate change. An advantage of accelerating this scheme is that it will now give the council a window to address the carbon footprint of its buildings in a timely way by reducing the estate and investing in material and heating interventions in those that are being reserved and refurbished for long-term use, such as the Civic Hall that we are now remotely assembled in, and Leeds Town Hall, where energy audits are already being progressed. Currently, approximately 60% of the council's carbon footprint is associated with its buildings. And these measures, along with appropriate locations to reduce travel, will provide a window to develop some flagship examples of low carbon environments. Hopefully, thank you, Lord Mayor. Just to say that hopefully that will be a signal to partners that Leeds means business on the climate change agenda. Thank you, Lord Mayor.
Councillor Jenkins.
Thank you, my Lord Mayor. First, I'd like to say a massive and profuse and from the bottom of my heart, thanks to the government, the forthcoming American government, for pledging to rejoin the Paris Agreement on climate change. I've been biding my time to say that. On the 25th of November, the government will issue its 1-year spending review for local government, and this follows from what Councillor Ritchie was saying. It's very disappointing that this is a short-term measure. The local government revenue spending is still 20 to 25% below 2010 levels because of the Tory and coalition austerity policies. The Treasury can borrow more or less without limit, but we will not be in a position as a council to help economic recovery if we are fighting for our economic survival and having to plan for yet another totally unpredictable 12 to 18 months. Trust has been in short supply from a government renowned for U-turns. We must ask how they've been spending taxpayers' money from the magic money tree. A challenge from the Good Law Project to the Tories' decision to hide COVID-19 spending has led it to disclose that the Department of Health has handed £17 billion worth of COVID contracts to private companies since April. Government has failed to publish details of 4.4 billion of these contracts. The contracts we do know about are alarming. First, PPE MedPro, the £100 company set up on the 12th of May 2020 by a former business associate of Conservative peer Baroness Mohn, was awarded contracts worth 200 million without tendering to supply PPE to the NHS just 7 weeks later. Its secretary is Anthony Page, who resides in the well-known low tax haven of the Isle of Man, along with another director. That 200 million would have easily met our financial gap. The audit office will have questions to ask about them making money at taxpayers' expense. And second, Kate Bingham, chair of the vaccine task force and wife of a Tory MP, spent $670,000 on a firm of external PR consultants, Admiral Public Relations, linked to Dominic Cummings' father-in-law, 84-year-old Sir Humphrey Wakefield. You couldn't make it up. While our council is totally open about all the savings and cuts we are forced to make, the Tory government seems more concerned about helping their friends and donors get hold of taxpayer money. The UK has a history of allowing the richest to contribute more at a time of national crisis. To fund the war effort and post-war reconstruction after 1945, the UK government raised taxes on income, inheritance, and luxury goods like motor cars. With that, Britain built a welfare state in the NHS. We are a wealthy country. The problem is the wealth is in the hands of the few. So our challenge to the government is give us what you promised, whatever it takes. Thank you.
Councillor Godwit.
I'm disappointed that the clean air charging zone won't be introduced, but I am proud of the work the council has done so far. And as Councillor Mulheron said earlier, there's lots that we are still doing. Here's some of it. We've developed more than 800 kilometres of new cycle networks. We've installed Orca wands for cycle lanes on parts of the A65 and the A660. We've reprioritised roads across the city centre and beyond to promote public transport and active travel, which reduces air pollution. We've instituted bike parking spaces, training sessions and more as part of the City Connect's bike-friendly schools and bike-friendly businesses schemes. And we've launched a pop-up bike hub in Kirkgate Market to support people coming into the city centre by bike, and a Try Before You Buy e-bike loan scheme that received around 250 applications within a week of its launch. So I'm particularly pleased with the work we've done with schools to encourage children to take clean air seriously. We've worked with all the schools in the city to promote and enable sustainable travel by developing tailored travel plans for pupils. Schools are being encouraged to sign up to national sustainable travel accreditation and to take part in active travel initiatives. 30 primary schools have introduced pool scooters, as well as free training and parking. And participating schools saw a 6% reduction in pupil car usage when they did this. The council has also led a number of education schemes related to air quality. We've trialled and publicised well-received toolkits for primary schools and delivered educational performances and workshops to 20 schools. And to reduce air pollution outside the school gates and promote sustainable travel, 14 schools have introduced restricted access to cars during the start and end of the school day as part of School Streets initiative, and there's many more who want to do that. Finally, 300 anti-idling banners have been produced and issued to schools, nurseries and other education facilities to encourage parents to consider the impact of the school run and switch off engines at the school gates. Unfortunately, some parents do resist this and argue with staff trying to enforce it, but we keep going, we persist. So all in all, I'd say the CAS process has been very positive, certainly not a waste of time and money. We should be very proud of our achievements, on which we can build for the future. Thank you.
Councillor Aidan.
Thank you, Lord Mayor. I'm speaking on minutes 41 to 47 and 66 to 69, with a particular focus on the air quality report. I think it's important to note that the decision not to introduce a clean air charging zone isn't a political decision made by the council administration. A non-partisan review made a judgment based on the scientific evidence and modelling so that there would be no legal basis for a charging zone. Nonetheless, it is clear that the council takes air quality seriously and continues to invest in improvements such as Councillor Garthwaite has outlined, despite our financial challenges as outlined in this minutes. It's something I take a particular interest in as chair of the Adults Health and Active Lifestyles Scrutiny Board. There's little point promoting outdoor activity to improve the health of our residents if they're breathing air which would be detrimental to their health. Therefore, I was glad to read about the progress in transitioning the city's fleet to electric and hybrid vehicles. The council's proud to operate the largest electric fleet in the UK, and we now have 2,300 petrol hybrid taxis and 10,000 ultra-low emission vehicle drivers in Leeds. This is good news, and I'd like to thank all those drivers who made the switch to hybrid and/or ultra-low emission vehicles. I'm glad to see that we are also continuing to support the transition to electric vehicles by installing dozens of charging points at Ellen Road, Temple Green and Sturton Park and Rides, and working with Wyker and NG to install 30 or more rapid charge points across Leeds by the end of 2021. We can't expect our residents to consider buying electric vehicles if they can't find somewhere to charge them. So it's good to see that work continues even when we are facing financial challenges. During this pandemic, we have seen many more people utilising our wonderful parks and green spaces. It is important to maintain and continue to improve clean air standards so that people can enjoy the outdoors safely. Thank you, Lord Mayor.
Councillor Medgley.
Thank you, Lord Mayor. I will be speaking in particular on the annual performance management report. The Best Council Plan is our strategic plan setting out how we will deliver better outcomes for our city. One of our aspirations is to make Leeds a child-friendly city, seeking to improve the environments in which our children live and play. The first years of a child's life are the most influential in their development, and they grow and learn best in a safe environment where they're protected from neglect and stress. Positive mental well-being is essential if children and young people are to flourish and lead rich, fulfilling and productive lives. There is no doubt that one of the biggest challenges facing our children and young people today is the impact of COVID-19 on their everyday lives and potentially their futures. 8 months ago, the country went into lockdown and schools and colleges were closed. No one really knew then what to expect, how long it would last, or what the long-term impact would be. As children now return to school in person, the hidden impact of the pandemic is now beginning to emerge. Save the Children have carried out one of the largest and most comprehensive studies on the impact of COVID-19 on children. Their results show a significant impact on children's health, nutrition, education, protection, well-being and family finances. And for some of the most marginalised and deprived children in our communities, that impact has been devastating. Young Minds, one of the UK's leading charities for children's well-being and mental health, found that the pandemic had put a huge strain on many young people. Over 80% of the children who took part in their survey stated that their mental health had worsened during the pandemic, and with many feeling increasingly lonely and isolated. Although we have now entered a second period of lockdown, schools and colleges remained open, and we all recognise the benefits of children returning to school. However, we cannot be complacent about the continued impacts of COVID-19 on their mental health, as well as the mental health of their teachers and support staff, who have been working relentlessly throughout this stressful time, delivering lessons and much needed pastoral support. For this reason, I'm reassured that in Leeds, our ongoing dialogue with our city's head teachers means that we're making the right decisions in the right way. But I am concerned that long-term impacts on mental health is being overlooked by the government at a time when our mental health service is already in crisis. It is clear that in the coming months, there will be an increase in the level of need and demand for services that support children and young people in vulnerable situations. The question now is, how do we manage this? Without additional support and funding, the children's mental health system will struggle to cope. Early identification and support is imperative if we are going to help our children and young people navigate their way through this ongoing crisis and into adulthood. I therefore fully support the Children's Commissioner in her calls for NHS-funded counsellors to be placed in every school, available for any child who needs one. I look to the government to prioritise the growing mental health issues facing our children and young people and give the support and the funding to our mental health services that is so desperately needed. Thank you, Lord Mayor.
Thank you. Can I call on Councillor Lewis to now sum up?
Thank you, Lord Mayor. And there was a lot of issues covered in members commenting on the minutes and a wide range of issues. So I'm going to pick them up in three groups, I think. First of all, those members that spoke about the clean air zone. And I really I know it's been a lot of changes recently around the implementation of the Clean Air Zone, but I think the point we've got to now is a success, and we shouldn't forget it is a success in that we have met the limits, the legal limits we were required to meet in terms of air pollution, and done so without having to implement a charging zone. And we've also, between ourselves and the government, we have got that agreed. Now, I don't think anybody, there's many speakers have criticised the government today. The one thing I won't do on the issue of the Clean Air Zone is suggest that 5 years ago, when they were telling us to do this and issuing ministerial directions, that they had foresight to see the position where we are at today, in terms of the vehicle fleet, plus many of the other changes, particularly around active travel that's happened and have brought this about. But I do think it is a success for the city, one we should take credit for, and I look forward to coming back to Executive Board in the new year with an updated clean air strategy. I've already started some of the engagement with all the interested groups about what that might contain. Councillor Midgley touched on the Best Council plan, and particularly around the impact that COVID has had on children and people's mental health. And again, I think as we come to looking at setting the objectives of the council alongside the budget, those are things where we do need to make sure we continue to really place a focus and look at, even though we may not have the money that we wish to have, we do need to keep delivering against where we say we need to deliver and support people as you come out of COVID. I think lockdown may have gone on longer than people anticipated or wanted, but clearly I think the legacy of COVID will last a lot longer than that. I think the final comments, I go back to the first speakers who touched on the budget and Councillor Caroline Gruen about asset sales. Everything we want to achieve as a city is driven by how much resource we have to do it. And we are in a period now, just to remind members, where since austerity started, we'll have had a cumulative total of £2 billion of government support taken away from the council at a time where one of the members referred to it earlier about council tax bills. There's been no relief on council tax bills. People have still been hit hard. It's just been the government. People in Leeds have been paying out for council services. It's the government that hasn't been paying out, and I don't think that's fair. And as Councillor Ritchie said, one of the things we need, as well as the amount of money, is actually knowing what we've got for the years ahead, so we can plan effectively around how we rebuild the city from COVID, how we support people in that process, and how we deliver services. As Councillor Gruen touched on around assets, there are ways we can try and plug the gap in terms of looking at where our assets are becoming, assets and buildings are becoming vacant. And sadly, we've seen it recently with the amount of staff going. We're going to have less employees in the years ahead, and that means we need less facilities and establishments for them to be based out of. We can use that. But let's be absolutely clear, Council, we are plugging the gaps there, and we need a long-term sustainable funding solution, as many of the speakers spoke about. And I think, as Councillor Ritchie and others said, the Conservative leadership at the LGA recognise that, and I hope we can work on a cross-party basis to make sure we've got the resources we need to deliver the services we want. I'll draw my comments to a close there. Thank you, Lord Mayor.
Councillor Blake to now, Summer.
Thank you, Lord Mayor, and thank you, Councillor Lewis and Councillor Charlwood, for summing up on their minutes. And I'd just like to pay tribute to the contributions under both of the sections. I think a very thoughtful consideration of the issues that are facing us. So I think as a city we can be incredibly proud of the work that we do in health, obviously through our own role in that on the Health and Wellbeing Board, and bringing together so many of the issues that were touched on earlier that means so much to people in our communities, whether it's the dementia strategy or all of the discussion around maternity services. Of course, we have been quite rightly concentrating so much of our health discussion in recent months around our response to the COVID crisis. But I really believe that all of the work that we've been doing over many years now, in fact, with our partners across the health community, are really standing us in good stead in our response to the pandemic. So I hope all of you who are out there working across the piece will pay recognition to their partnership role. It really isn't as easy as it would appear to be to bring together the different public sectors. They do have very different cultures, different ways of working. And I think it's an incredible tribute to the work that's happened over that time, that there is now the trust and the respect that enables us to do so much more. And I think, as Councillor Charlwood said, bringing the voice of the user in to discussing all of the areas that we cover has never been more important. Councillor Lewis summed up obviously on his minutes, and I think it's I think I'd echo his comments. Councillor Ritchie mentioning James Jamieson, the Conservative chair of the Local Government Association, and we, look forward to working cross-party in Leeds. We have the opportunity coming up soon with the comprehensive spending review, and of course the settlement that we will determine how much money we have in our budgets going forward. I would echo the disappointment that again we're going to be looking at just a one-year settlement. Obviously, the times are difficult, but it really does need us all to come together and recognise that we can't just keep going through the financial situation 1 year at a time. Some of the issues that we're facing need long-term planning and solutions, and I really do hope that all parties on the council will come together with us to make sure that Leeds gets our fair share. We know that the money that the government has given to local authorities in response to the COVID crisis has not covered the costs, and that is why we're facing such difficult times with our budgets for probably the years ahead, if they don't come together and give us the support that they promised us right at the beginning of the crisis. We must make sure that there is real scrutiny of the way that decisions are made about how funding is distributed. I'm not sure if you're all aware of the Public Accounts Committee's scrutiny of the way that the recent Towns Fund has been distributed. I would urge us all to look at that report very carefully, and perhaps we can bring back a discussion on that to ensure that that fairness and response to need is honoured by government departments when they're looking at how they distribute money to us all. And I'll go back to the report I mentioned earlier from the Northern Health Science Alliance and just pick up on some of the costs that they are identifying, and really recognising their call for, if the government is serious about the levelling up agenda, then they really have to address these issues in the CSR before Christmas. What we know is that the cost of increased mortality in the north, and we know that there has been an increase because of the pandemic, is costing £6.86 billion. And the cost of the reduction in mental health, and thank you for the contributions around mental health and the impact, is running at around £5 billion per year. These are really serious issues that the government has to take on board. And there is an estimation that 16 billion there's been a 16 billion cost in lost productivity since 2011 across the north. These are shocking and enormous reflections on what we have been pointing out repeatedly over the last few years of how short-sighted the cuts that have been made to us across the north in councils, but also in other public services as well, and how dreadful that the impact of that, which we've been warning about in a general sense, has come to have such a dreadful impact when faced with the pandemic. And it is no shock to us that the health inequalities that we've been highlighting through this council, through our debates, the impact of the cuts in our children's services and adult services for the most vulnerable in our communities, unfortunately, has made us even more vulnerable because of the way that the pandemic works. It is described as a very clever virus, seeking out vulnerability and really doing the most damage in those areas, particularly of high deprivation. We heard earlier this afternoon about the impact of the pandemic on employment in the city. And I think this is something that we need to make sure that we pick up as we go forward with our economic recovery plans, both at a Leeds level and also at a West Yorkshire level. The unemployment rates, the increasing claimants for universal credit are just eye-watering. And unfortunately, the figures that we've heard today don't include the predictions for the impact of this second lockdown. So it's time for all of us really to stand up and be counted, recognise the impact of the last 10 years of austerity in our area, and coupled with the impact of the pandemic, and really make sure that we get a coherent voice to government. One of the areas that I've been working on to really try and get this message home is working with our partners. And we know that over the last months since March, so many people across our city, whether in business, in the public sector, in the voluntary and community sector, have come to recognise and value the incredible work that as a council we do. And they're now beginning to realise the prospect that we will not be able to do as much of that work as we have done in the past because of the pressures on our budgets, the cuts that we inevitably are going to have to make. I'm delighted that so many of them now are speaking up on behalf of our great city and on behalf of the work that we do for those most vulnerable people out in our communities. So let's keep going. There's been a lot of talk about cross-party work today. So let's make sure that everyone honours that commitment and works with us to get the message across to government. They have an opportunity before Christmas to address some really serious matters that we've been drawing to their attention for many years now, and of course have become that much more vital because of the...
Blake.
Thank you very much, Lord Mayor, for listening. Thank you.
Thank you. I'll now call on the vote for the motion. Any members who against or abstain, could you please speak up? I'll take silence for yes. Thank you. We'll now adjourn until 4:30. See you at 4:30. Hello, everyone. Welcome back. We'll now move into the white papers, which will take, each white papers will last no more than 30 minutes. Can I also remind members of the information which I did earlier in the meeting? At the previous remote meeting, I'll be calling on all whips to vote on your behalf. If any members wishes to cast their own votes differently, please indicate so. If a recorded vote is requested in accordance with CPR 16.41, propose to manage the vote in the same way and how a member vote will be recorded. So could we go to first white paper in the name of Councillor Amanda Carter? Councillor Carter? You're mute, Councillor Carter.
Lord Mayor.
That's it.
Thank you, Lord Mayor. I'm now unmuted.
Yes, you are.
The managed approach was first trialled in 2014. I think a number of us were very sceptical and pointed out the potential problems and concerns. We now have evidence of how it's worked in practice and have direct lived experience of the local communities. In 2018, we called on the administration to prove that they could make it work or suspend the policy, and we welcome the announcement of the independent review into its future. The survey by the council commissioned to review tells us nothing and has lost all credibility. Although it does concede that the findings cannot be taken as representative of the people of Holbeck, at last the voice of Holbeck, the community, and importantly the children have had a say. Listen to this. One child said, "It's hard living in Holbeck. Prostitutes getting into car makes me feel vulnerable. It's not managed at all. We are approached. What children are experiencing in Holbeck is not just wrong, it's dangerous. How long is it before a child is assaulted, abducted, or raped? The prostitutes in Holbeck mostly have mental health issues, addictions to drugs and alcohol, and are controlled by men. Their life is short and filled with violence committed by punters and pimps. How do parents even begin to explain that it isn't right and it's not safe, even though the council are openly allowing this to happen? Don't we have a duty to protect children? It's only a question of time before something terrible happens to a child. By allowing them and normalising this terrible way of life,
Cut off.
where is the serious safeguarding children's issue? What about the residents? Don't they deserve better? How would you like it on your doorstep? Local opposition to the managed area is strong and they have evidence to back it up. Isn't it time you stood up for them? I want to see more effort from Children's Services protecting the children who live and go to school in this area. I want to see work done on an exit strategy. I'll sit down and work with you. I'll help you lobby government. The administration needs to now move at pace to build on the work of the independent review and design a much better way of listening and engaging with the people of Holbeck. We ask that this strategy should be part of a regular series of reports that come to Executive Board to include updates, input. It's time for action, to start to reduce the size of the managed approach and work on an exit strategy. The administration must listen and engage effectively and then respond to the genuine concerns of the people who live there. I move the white paper in my name, Lord Mayor.
Councillor Robinson, second.
Thank you, Lord Mayor. I formally second and reserve the right to speak, which I will be executing.
Thank you. Councillor Cooper.
Yeah, thank you, Lord Mayor. I have to say that I'm moving this amendment today with a feeling of disappointment. And I hope that everyone in this council recognises on-street sex working is a difficult and sensitive issue, and it shouldn't be kicked around like a political football. It's something we need to respond to in the right way for so many reasons. This is part of the reason we have had an independent review into the managed approach. The review had a number of recommendations and we are working our way through them in a structured and organised way. And because we realise it's a sensitive issue, I wanted to make sure that opposition members were kept fully informed and briefed, which is why I invited Councillors Carter and Robinson to be part of that work going forward with the recommendations of the independent review. I would further like to add, when it comes to the managed approach, safeguarding is a top priority, and that covers everyone that might be impacted by it. If you have any concerns about activity, Councillor Carter, then can I urge you to report those through to the police on the dedicated number, and at least through the channels that you know are open to you. We all know that there are people who are ideologically opposed to on-street sex work, and there are a wide variety of views. The managed approach came about to mitigate the impact on local residents because on-street sex working was already taking place in the local area. And previous policing approaches, which were mostly enforcement-led, had been found to achieve very little, with a significant number of complaints regarding sex working taking place in residential areas continuing to be reported. It's why we considered and progressed the managed approach. I have to say that I'm pleased with the work that we've done so far. It was not an easy start and it's not been an easy journey, but there is an overwhelming feeling things have got better from almost everyone involved. We have put a huge amount of work into working with local residents, local members and police to try and reduce the impact on the local community. It's seen the introduction of a dedicated call line for the reporting of on-street sex work related incidents, a fully resourced dedicated policing team, an effective strategic command and management structure put in place since late 2018, as well as dedicated cleaning crews. That isn't to say that there isn't still work to do, and the independent review recognises that. It put forward a rigorous way of getting views, including focus groups, individual interviews, interviews with pressure groups, attending all the Listening Well meetings, I might add, which the author of the review included in his own review. Resident surveys and social media promotion, making sure we get a full community view is absolutely crucial for us. And it is a recommendation in the report that we are already making good progress on. We are developing new arrangements for consultation and engagement to ensure that we capture the views of local residents, as well, Councillor Carter knows.
Councillor
There have been many different opportunities to raise these concerns, Lord Mayor, before the independent review reported. I can honestly say I'm seriously disappointed with this white paper today.
Thank you. Councillor Scope?
My Lord Mayor, I'm happy to support this white paper amendment. I'd like to agree with Councillor Cooper's point that this feels like an odd time to bring the white paper. Yes, the independent review is finished. As a council, we're working through its recommendations. However, while the Listening Well report has finished, the report is still being finalised. I've been really careful not to jump in with ideas about the future before the Listening Well project is finalised. That's what listening looks like. It takes time, but it is worth it. There's no foot dragging, no trying to hide the unflattering parts of the report of either of these reports, and we will continue to engage with residents on how to move forward. Councillor Carter talks about the residents' voice. I wonder how many residents she has talked to, not representatives of campaign groups, but actual residents inside the M621. I wonder if she's even consulted the voice of Holbert before issuing this white paper. I've read the draft Listening Well report, and there's no doubt that street-based prostitution impacts on residents, both young and old, and in particular women. This is why we need to work together to reduce street-based prostitution. If you look at the actual data in the draft report, students are more worried about drugs, about violence, about alcohol, and about gangs. See page 24. And it shows the priority for most residents isn't getting rid of the managed approach. See page 22. To be clear, this does not take away from the seriousness of the issue or the impact it's having on residents. The issue of street prostitution is a subject that needs ongoing, serious, adult conversations and level heads, not sporadic political point scoring, which this white paper is part of. It's important we give the Listening Well project a proper chance to put forward its recommendations and look at a structured and organised way to respond to them. We need to work hard to ensure that residents' voices are heard, not outside pressure groups on either side of the debate. Like Councillor Cooper said, this isn't a what-if situation. This is daily life. While street-based prostitution exists, we need to reduce its impact on our community. The managed approach isn't perfect, not by any means, but I believe it remains the best solution given the UK legal framework and the solution the Council is committed to improving year on year. Getting rid of the zone sadly does not get rid of street-based prostitution either, as we've actually seen during lockdown. It just limits our ability to reduce the impact on the local community, as well as the people, predominantly women, who are selling their bodies. As a councillor, I extend an invitation to Councillor Carter or any other elected member to have a candid dialogue outside of this political theatre about how we can improve the lives of residents in my ward. I've met with and will meet with anyone who wants to discuss the merits or otherwise of the managed approach, in the belief that using the collective wisdom of residents, elected members, council officers and the police is valuable. Thank you, my Lord Mayor.
Thank you. Councillor David Blackburn.
Thank you, Lord Mayor. I think starting on this, I think I've always been somewhat agnostic about my approach to the managed area, and being open to the information I get. Certainly 2 years ago, I think 2018, when it came up before, and we said we'd have a review, a motion came up for a review. I supported that because that was the feeling I was getting fed to me from people who live down there, and certainly my own members who live down there, that the system wasn't working properly. When the independent review took place and it was reported to executive board, I got a briefing on that. And what concerned me, and I couldn't get any good answers, and I was going to raise it at the council meeting, but we didn't get to that meeting, was the fact that the lack of numbers of people who live locally who had been consulted, and the lack of businesses that had been consulted. But as I said, I have an open mind on this. I have no way, one way or the other. But the fact is, when I come to check and speak to people I know who live in the area, the feeling I get back is that it is not working right. If you saw last night's Look North, the principal of the Gauze Academy and some school children were on there about problems they're having from the managed approach area. And I've got in front of me at the moment the draft of the Listening Well report, and it don't make good reading. So as far as I'm concerned, I think that we should pass the motion in the name of Amanda Carter. I've got to say that the amendment from the executive member does have does show that she seems to be listening, but I think we may have got past that point. Thank you, Lord Mayor.
Councillor Galton.
Thanks, Lord Mayor. Some of the administration speakers so far have made a good point about how some of the councillors that are concerned about this subject don't live within inner city South Leeds, and therefore do not have a direct lived experience of the managed zone. However, some of us have had experience of living near a red light district, and when I was growing up as a child, I lived next door to the Spencer Place red light zone that there was in Chapeltown. And I know that some of the problems which are being experienced and have been highlighted today are the problems that you get with any red light district where a district gets known for having available prostitution on its streets. The difference here is that the managed zone is meant to imply that the experience of both those who are selling sex in that area, but also the general community who are associated with it, would feel some benefit from such management. And I think this is the issue that we have here now. My group has consistently supported the managed zone for several years, and personally I've been involved through my Rotary group with fundraising for the Joanna Project, which helps women who have to work in that area because of the circumstances that they're in. And I know that a lot of those that are servicing those women to try and get them to leave prostitution as their way of living, they appreciate the stability that the managed zone delivers. However, the testimony that we've had lately from people like the principal at the Ruth Gorse Academy and the direct relations of experience by pupils of that school should make us reflect and think, do we need to reevaluate what success looks like when we're talking about a managed zone? We shouldn't just talk about how effectively we are listening to the people that we already talk to. We need to be thinking, if other people are telling us there's something wrong, how do we engage with that as well and rethink and reevaluate? So we are going to support the Conservative motion here, but it's in the spirit of not rejecting the managed zone incompleteness, but to look at, can the managed zone be delivered in a more effective way to actually live up to what it's meant to be? Because at the moment, there are too many failures within it, and it is not a good livable experience for the community that it's with. And it therefore lets down the women it is meant to be supporting as well, because they are not supported by the general neighbourhood that they're working within.
Councillor Galton? Councillor Field?
Thank you, Lord Mayor. Lord Mayor, enough is enough. This administration is hanging on to a policy that has run away from them, and they'd rather cling on to this inherently exploitative albatross around the shoulders of this city than admit defeat. The prostituted women of Holbeck are now barely functioning as human beings, and this council has allowed demand for their bodies to spread like a disease. We are now at a point where the head of the local secondary school has pleaded for the end to the managed approach, as he fears it is only a matter of time before a schoolgirl is abducted. It is a child safeguarding emergency. Bearpunting.net. Go on that website, that's bearpunting.net. Have a look at the men on there who review the women of Holbeck using some of the basest, most morally reprehensible language you'll ever come across. When there's no threat of arrest, men not only feel free and cocky and safe, they see paying for sex as a utility like any other, so a lack of consent is just poor customer service. The opportunity and freedom this council is affording men to buy and abuse women without consequence informs every aspect of their behaviour and moral compass and affects society as a whole. This council needs to recognise prostitution as violence against women and fund proper exit strategies. This council needs to go after the demand. Instead of free rein for these lowlives at certain hours, we need to ramp up prosecution so they finally face consequences. We need to catch them, out them, and shame them. Apparently, we are lighting up the Civic Hall to mark International Day for the elimination of violence against women. Well, I suggest the Labour group takes that light and shines it over Holbeck instead, if they're that proud of the managed approach. Councillor Cooper, you are not dealing with sex work, you are dealing with modern slavery. And shame on every woman in this council who calls herself a feminist for supporting this. We will be supporting the white paper in the name of Councillor Carter and call for the Nordic model now.
Councillor Stevenson?
Well, thank you, Lord Mayor. I am rarely lost for words in council or elsewhere, but I have to admit to being absolutely stunned this week by the complete lack of compassion, contrition, or political nous from this administration. Councillor Cooper says she's disappointed to be discussing this today. Well, she should take a moment to think about the fears of parents living in that community. Councillor Scopes might want to know the views of his own residents sending their children to school in that community. In a week when child safeguarding concerns within the so-called managed approach have been reported on national television, in nearly every national newspaper this morning, it's quite frankly disgraceful that this administration actively chose to move an amendment that removes any reference whatsoever to children's safeguarding, pupil welfare, or schools. Not a single exec member within the portfolio has spoken on the concerns raised by school professionals, school leaders in that area this week. It cannot be right, Lord Mayor, that the administration can claim that the managed approach is working well when faced with the harsh truth that an approach sponsored by the council and championed by the executive member has led to schoolgirls being approached for sex on their way home from school. Increasingly, child safeguarding in Leeds seems to be buried under wider political narratives by this administration. How on earth can the council promote its child-friendly credentials whilst actively creating a huge safeguarding risk to pupils in the area? Be under no mistake, Lord Mayor, when this council chose to manage the zone, when this council chose to stamp the council insignia on it, this council took direct responsibility for the area. The safeguarding concerns raised by pupils in South Leeds are a direct result of a political decision in the creation of the council's managed zone. And to add insult to injury, this administration has attempted to simply dismiss the safeguarding concerns by advising pupils to let the council know of any instances of wrongdoing in the area. These are hollow words, Lord Mayor. Only last week, the council's Safer Leeds officer acknowledged in correspondence with schools in the area that these safeguarding concerns were raised with the council last year, yet nothing has changed. I doubt anything I can say today will make the executive member change her stubborn mind. But I hope at least a small amount of humility has allowed for a sense of shame when reading the distressing experiences of children in the area. So I want to close, Lord Mayor, briefly by reading the words of a school pupil named Hawa Mariam, who has published an open letter today to Leeds City Council. Hawa says, I'm 16 years old. I've lived in Holbeck all my life, and I'm a fourth generation in my family to live here. Holbeck is my home, yet I'm ashamed to call it so. The managed area was supposed to make it easier for women to exit this trade, therefore reducing its impact on Holbeck. So can the council tell us, has the managed area scheme allowed more women to exit the trade than it's allowed to be introduced to it? Is there a next step or a phase to this scheme? What is the exit
Councillor
criteria?
Stevenson.
Thank you, Lord Mayor.
Thank you. Councillor Esselberg.
Lord Mayor, comrades, I'm proud to be supporting the amendment in the name of Councillor Cooper. We all acknowledge that the managed approach is not ideal, and I think it's important that in this amendment we acknowledge it's not a permanent solution either. However, it is the solution that we need for the moment, and it's a solution that is making things better. The independent review carried out found that it was, and from what we are hearing from people in the area, most people think it is making things better too. But we know that that's not everybody, and we all know we need to find ways of engaging with more people on the issue, but all the evidence does point to the fact things are getting better. We know that this is a very emotive subject, and it can be easy to lose sight of the fact that the women who work in the managed approach form some of the most vulnerable and marginalised sections of our society. It's important that we remember that. If we were to scrap the managed approach right now, the problems that it was set up to address will not just disappear, and the women won't stop on-street sex work. Since the managed approach was introduced, it's a fact that these women feel safer. In 2014, only 7% of crimes against women working in this area reported, and that's now over 50%. Part of the fact is that the women feel able to report crimes against them, and they feel they can seek justice as they've seen men prosecuted for the attacks, and this is a huge step forward for them. I would also like to mention the amazing work the charity Basis Yorkshire are doing, who work tirelessly to support the women on the streets. We know from what Basis have reported that since the introduction of the managed approach, they're able to work with women for longer and are better able to offer help and support. For some women, this means getting them out of that situation, that life, off the street and into treatment if that is what is needed. It's one of two core parts of the managed approach, making sure that we can keep these women safer. That's not to say that it's any lesser or greater than engaging with the community, but it's a site that too many can lose focus on and forget that when we talk about the managed approach, we are talking about actual people. People who are not just a statistic to debate in these meetings or to protest. They are mostly vulnerable women who deserve the same levels of protection and support, and more importantly, the same levels of respect and compassion as anybody else. I am pleased to support this amendment, Lord Mayor, and the work that we are doing in Holbeck.
Councillor Robinson.
Thank you, Lord Mayor. In moving this, in seconding rather this white paper that's been moved by Councillor Carter, we've covered a lot of issues already in the debate. We know the history of the managed zone that's been sketched out. The challenges are clear. What the BBC and other news agencies have reported this week is deeply concerning. And what I've read about what's going on in the managed zone and what people have told me, I am very, very concerned about. The review has taken place and it appears to have failed to have adequately recorded the residents' engagement in a substantial way that raises all the concerns that they've raised. Now, we should thank the police, the officers of the council, the third sector bodies and others who are working to try and improve the lives of the vulnerable women in the zone. And let's be clear, Councillor Hesselwood is right. These are vulnerable women. These are women who are battling addiction, health issues, housing issues. They're battling the drugs, violence, alcohol, gangs, the issues that Councillor Scopes talked about that young people are fearing in the area. However, the managed zone does not seem to have an exit strategy. It isn't a strategy that seems to have a future. The Labour amendment says that it isn't a permanent solution. It appears that at the moment, it is the only permanent solution that is being offered. There is no approach to change or veer off or do something different. What our white paper suggests in terms of reducing the size of the managed zone, and if it's true, the information that I've been passed and the statistics, that less women are working in the area than they were in 2014 and 2018, then presumably the size of the zone can be reduced and you can target support and efforts far more adequately in a far more intelligent manner. But that doesn't seem to be the case at the moment. So what we need to do is look at what has been a success and build on it, the work that's been done by third sector agencies, but be very, very clear with the people of Holbeck that this is not the future for them and that an exit strategy, a way out of the current circumstances that they find themselves in, is what has been proposed by this council and what does have that council's mark and stamp of approval. Regular reports back to Executive Board mean that we discuss the issues and the people involved too, rather than this be some sort of abstract. And it is right that we discuss this rather than try to sweep it under the carpet. Within the report, within the reports and the information, there's also talk of a PR strategy for Holbeck. I'm afraid that a PR strategy that advocates the managed zone is no strategy at all. An exit strategy is what is required. It is certainty, support, help, and action that people need, including the women involved. Thank you, Lord Mayor.
Can I call on Councillor Amanda Carter to now sum up?
Thank you, Lord Mayor. Councillor Scopes, I just wonder what planet you're on and if you actually talk to your residents. Any mother cannot be failed to moved by what those children have said. You need to go and talk to your residents. Nowhere has Councillor Cooper, in her amendment, does she comment on children's safeguarding. You now have evidence from the young people themselves telling you of their frightening experiences. Are you ignoring them? Are you saying it's not true? Despite your assurances through the BBC, it's my understanding that it's over 3 weeks since the Acting Director of Children's Services received a letter from the Gorse Academy highlighting the issues. I'm told there's no reply yet. How dare you pretend it's a child-friendly city? Or are you just child-friendly elsewhere and not Holbeck? Councillor Blake, Councillor Scopes, Councillor Cooper, you should be utterly ashamed of yourselves. Maybe it's just your well-known antipathy, particularly Councillor Blake's, towards the academies and Gorse in particular that's impaired your judgment. By continuing the managed approach, you are damning the area for good and the lives of the people who live there. You're preventing significant investment and development into Holbeck. If you want to regenerate the area, you'll have to scrap the managed approach, or because you're never wrong, you must move it elsewhere. So watch out, citizens of Leeds. My Lord Mayor, I'm calling for action now before it's too late. This isn't a political football. This is for a long, long time. You've had 6 years to sort this out and you haven't. Stop shouting to the world about how good the managed area is. Stop pretending it works. Put your egos back in a box and stop messing about with people. Get this sorted out. I move the white paper, Lord Mayor.
We'll now go for a vote. I'll call the whips to vote. We'll vote on the amendment of Councillor Cooper. Councillor Dawson, are you for, against, or abstain?
Lord Mayor, we're for the amendment in the name of Councillor Cooper.
Councillor Cohen, are you for, against, or abstain?
Most certainly against, my Lord Mayor.
Councillor Campbell, are you for, against, or abstain?
The Liberal group are against.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBIs, we are against. Thank you, my Lord Mayor.
Councillor Field, are you for, against, or abstain?
The Garforth and Swillington Independents are against, Lord Mayor.
Councillor Anne Blackburn, are you for, against, or abstain?
The Greens are against, Lord Mayor.
That's been carried. I now call for the vote on the substantive motion in the name of Councillor Cooper. Councillor Dawson, are you for, against, or abstain?
The Labour group vote for, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
Thank you, my Lord Mayor. The Conservative group are against.
Councillor Campbell, are you for, against, or abstain?
The Liberal Democrat group are against.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group are against.
Councillor Field, are you for, against, or abstain?
Thank you, Lord Mayor. We are against.
And Councillor Anne Blackburn, are you for, against, or abstain?
Abstain, Lord Mayor.
That's been carried. We'll now move to the second white paper in the name of Councillor Cooper. Councillor Cooper.
Thank you, Lord Mayor. I'm bringing this white paper today to raise a scandal that should never have happened and is shamefully only getting worse. It is over 3 long years since we all remember seeing the horror of Grenfell. 72 people tragically dead, 70 more injured, and 223 lucky to otherwise escape with their lives at the cost of their homes. It brought to light the danger that thousands around the country had unknowingly lived with. The fact that it remains an issue is a national source of shame and fury. I would like to acknowledge the tireless work that groups across the country and here in Leeds, including the fantastic work by the Leeds Cladding Scandal Group, are doing to make sure the government does not let this slip through the cracks. Let me make it clear that our council high-rise blocks in Leeds are not clad in ACM, and we have done extensive work that we've carried out on fire safety for these blocks, including a programme of sprinkler installation. The main issue in Leeds is on privately owned blocks, and we're seeing more and more people caught up in this scandal in Leeds. We see them threatened with bankruptcy as they are forced to pay for expensive waking watches and increased insurance bills. The ever-present fear that they will be asked to pay to fix a problem for which they are not responsible. It's a constant toll, both financially and mentally. As if these ongoing costs wasn't enough, the government is now saying at least some of the cost of fixing dangerous cladding will fall on leaseholders. For over 3 years, they have dragged their feet, and now, instead of offering a way out, offer financial ruin or worse. The government has said the cost will be affordable, but unfortunately, we all know that the government considers affordable doesn't match up with what we know in the real world. If the government was serious about this grave issue, it would have acted quickly to remove the type of cladding that led to the Grenfell tragedy. It would have started an inquiry that sought to make real changes first, rather than starting with laying the blame. It's been over 3 years. Where is the urgency? Where is the government's drive to make change? Have they forgotten that people across the country are living in fear of another Grenfell in their tower block? Or do they not care? Why is it after 3 years nothing substantial has changed? Worryingly, the type of cladding used on the Grenfell Tower is only the tip of the iceberg. When it comes to this issue, we know there are other concerns about medium-rise buildings and non-ACM clad. They don't fall under the parameters of watch and brief. We know that what lies beneath the cladding is insulation, and that can also be an issue regarding flammability. Outside of the horrific loss of life and home from Grenfell, there is an ongoing human cost to this sluggish government response. It's putting people's lives on hold, leaving them in a hellish limbo. People are unable to sell their homes or move on as they are locked into a building that is now a prison, scared for starting a family or giving up work. Thank you, Lord Mayor. Searching because they cannot move to new opportunities. I would hope, with that in mind, every member of council will support this white paper.
Thank you. Councillor Ray to second.
Thank you, Lord Mayor. I am happy to second the white paper in the name of Councillor Cooper. Imagine saving heart to buy your first home, a city centre in Parliament in the heart of one of the greatest cities in the UK. The happiness and personal satisfaction in doing so. Then imagine to be told it has a list of significant fire safety issues which, if not addressed, could make it a death trap during a fire. You are then told that unless you keep paying thousands of pounds for interim fire measures, you'll be forced to leave your home. And just to make things even worse, to be then told your home is now worthless until all the repair work is completed and the freeholder wants you to pay part or all of the costs, with one building quoted in Leeds as costing nearly £9 million to fix. All due to the greed of some developers who use fire safety contractors who cut corners and use loopholes to get around fire safety regulations, and all legally. This is the nightmare many of my constituents face. Understandably, residents turned to the government and asked for help. But despite some fine promises and empty words, the government has committed funds to only a small fraction of what is needed. What is their plan for the rest? This is truly a national scandal taking shape in our city. The government must lead an urgent national effort to remove all dangerous cladding from buildings by June 2022. The government must prioritise the safety of people living in all the buildings where there is recognised fire safety issues. We sadly know all too well the very real consequences of leaving buildings unchecked. The Building Safety Fund must cover all buildings, regardless of their height or their internal or external fire safety defects, not just cladding. Failure to act on these and other reasonable demands of the Leeds cladding scandal group will have a devastating impact for many people who own homes in the city centre and in particular my ward of Hunsleton Riverside. Many flats now can't be bought or sold until safety work is completed, trapping their owners in limbo. They are facing 100% of the bill in some cases to fix a mess they did not create, even though their ownership is sometimes as low as 25%. Indeed, a large proportion of leaseholders in Leeds are young people. They are first jobbers. Combined with the impact of the pandemic on their jobs and mental health, this scandal is destroying their finances, pushing many to bankruptcy and devastating their well-being. It is stalling their futures. This is a perfect storm and the government must act to resolve it now. Thank you, my Lord Mayor.
Thank you. Councillor Bentley to move the motion. Amendment, sorry.
Thank you, Lord Mayor. And I can assure you my phone is very much on mute at the moment. I can't afford any more. As Councillor Cooper said, I doubt if any of us can forget the horrendous sight of the Grenfell Tower lighting up the night sky in an uncontrollable blaze, and then hearing reports of the ever-increasing loss of life as the night wore on. An incident that was so unimaginable in the United Kingdom in the 21st century. It was happening before our very eyes. And after our initial feelings of horror and disbelief and sympathy, I suspect the reaction from most of us was, could it happen here in Leeds? And the response from the council, both the political leadership and the operational management by officers, was swift, effective and exemplary. All the council high-rise housing stock was checked where fire safety procedures were lacking. They were corrected, and as Councillor Cooper reminded us, a programme of sprinkler installations was put in without waiting for necessarily government support for that. And then a communication campaign reassured tenants of their safety and gave them the opportunity of raising fears and concerns. Now, why have I reminded members of this? Well, it demonstrated how a good landlord responds not only to an immediate danger, but also ensures that its tenants' homes and well-being are protected in the future. and how different from the hundreds of private leaseholders in Leeds that the white paper mentions. People who are still living with the dark cloud of Grenfell hanging over them, and because of circumstances wholly outside their control, their properties have become unsaleable and their lives put on hold. So we do support Councillor Cooper's white paper in principle. We have put in a slight amendment which doesn't detract from the thrust of the white paper, but just makes it clear that this isn't just another ask for more money from the government, but it is not fair that residents should be so disadvantaged because private developers are not standing up to their responsibilities. So we are emphasising that part of the campaign which asks the government to forward fund the repairs and make arrangements to recover the money from those responsible. That way, the residents of these properties will be released from the nightmare they have been living through. I move the amendment, Lord Mayor. Thank you.
Councillor Campbell, a second.
Second, and reserve my right to speak, Lord Mayor.
Councillor Barry Anderson to move and second the amendment.
Moving a second amendment. Thank you, Lord Mayor. I mean, Councillor Cooper mentioned she was disappointed with the last white paper. I'm disappointed that she's chosen to bring it forward this way to this council. When the Grenfell disaster first occurred, Executive Board commissioned our own scrutiny boards to carry out various pieces of work. Why not ask us to do it on this occasion as well? We could then have a number of things together. All we've got is now the council's usual default response: let's spend more taxpayers' money. Let's not look and see who is actually responsible. Let's just spend taxpayers' money. We feel that the council should be working cross-party, working with all of us in order to move this forward and use all the influences that we've got. We should be getting all parties together and agree strategies on, for example, evacuation plans, making sure that the fire authority expertise is used properly. We need to get the owners of the buildings in a room and let's see what we can do to get them to change their ways of doing things. We need to get the manufacturers of the materials to a meeting. We need to get the developers who built them to a meeting. We need to get the builders who built them into a meeting. As a city, we need to know what proposals each building owner has and their estimate of the cost and their funding shortfall. There's been no mention of how much it's going to cost. Maybe Councillor Cooper can, in the summing up, can tell us all. What is the legal position of the leaseholders? That's not been mentioned today. What is the view of the insurance companies? Now, this is where the LGA can help. The LGA did make some comment about this, but it was a few months ago, even a couple of years ago. They now need to bring it forward, and that's why I'm calling on the leader to the next time she goes to the exec board that's down in the LGA, she asks them to join and work with Leeds in moving this issue forward. Yesterday, at the climate change workshop, we were told that we need between 6 and 14 billion to develop an energy strategy. Which is another big ask. Now, is that more important? No, it's not. The answer is both are equally important and we need to get work done. But we don't need to just keep asking the begging bowl, Oliver Twist-like, asking for more and more and more. Let's work together, cross-party, cross-sector. We are greater than the sum of our parts. Everyone has a role to play. The administration has a role to play. Let's see what the colour of the administration's own money. There are plenty of savings you could make yourselves and that you could then invest it if you believe that it's worthwhile paying for the costs up front. The council have got good powers, so they can use what they're doing. So with that, Lord Mayor, I put forward the second amendment.
Councillor Arrington, second.
I don't think so.
Arrant, my Lord Mayor.
Thank you. Thank you. I second Barry's amendment. Anyone who's followed this tragedy from the beginning will know that nobody comes out of it well at all. No local politician, no national politician, London Fire Brigade, who admit it, no developer, no professional of any sort. Even I'm being to believe the Grenfell inquiry itself, none of those organisations and bodies emerged well. It's been a disaster that was made worse by the people who should have made it better or even prevented it altogether. There's one phrase in Barry's amendment that's more important than the others. Refers to the Leader of Council making representations through the LGA, and that is exactly right. Earlier on in another debate, Councillor Blake referred to the need for quiet discussion about a subject, and she's quite right as well. This is not a matter for party political argument. Colleagues on the Fire Authority, as I am, will say that Grenfell is often on the agenda down there, and there's never been any party disagreements between members in our comments there. It is disappointing that you chose to bring party politics into tragedy that took so many innocent lives. Discussion on matters like this is best conducted with discretion and without shrill partisan accusations, which is just what Councillor Cooper and Councillor Scopes were saying 25 minutes ago. You'll win your vote this evening. Perhaps some of us on all sides would have preferred it to have been handled with greater charity and sympathy. Thank you, Lord Mayor.
Councillor Anne Blackburn.
Thank you, Lord Mayor. As has been said a few times since this motion started, we know that the council did take fairly quick action after Grenfell. The council in Leeds did, even though our blocks were not clad in the material that the Grenfell flats were. We were very concerned, and yes, they did put sprinklers in. I even asked about blocks, a couple of blocks in my ward at the time to Councillor Cooper to make sure that sprinklers were put in there. But these leaseholder flats, the people who are responsible are dragging the heels. It's as if they don't care. And the people that the leaseholders are left in flats that they obviously feel uncomfortable with. I'm sure none of us would want to be in that position. It just isn't fair on them. You lease a property and you see it, you think, yes, it's fine. And then suddenly you're in turmoil. They probably can't sleep at night. I just think it must be totally terrible for them. I've got total sympathy. And I think that even though they're not council properties, we should be trying to help them whatever way that we can. But I do not think that the people that's responsible for putting this ACM cladding on should get away with it. They should pay, and they should make sure that those buildings are made suitable for the leaseholders to live in, that they are safe. And so we will be supporting Councillor Bentley's amendment, because it does state about doing that. We must make them responsible. I know yes, we should borrow from the government so that the money quickly gets to these leaseholders, so that the work can quickly be done. We must help them, because they must be going through terror every night they're there. Can they go to sleep?
Blackburn.
Yes, that we will be supporting Councillor Bentley on this one. Thank you, Lord Mayor.
Councillor Drinkwater.
Colleagues, in the past 2 years, I've only spoken once in full council, and that's not because I've got nothing to say. For me, it's about finding an effective forum for debate that makes a difference. However, I took this opportunity because I thought you all might appreciate me sharing my lived experience. Part 1 of the Grenfell Inquiry report shows that this was a wholly foreseeable tragedy, with its prime cause rooted in cuts and deregulation. I would guess that I'm the only person in the meeting who's been involved in high-rise firefighting. I spent most of my career at Stank Station, which served an area with many high-rise council blocks, so I was regularly involved in fighting fires in high-rise buildings. I've dragged someone out of a flat that was on fire. I've been in buildings that were starting to collapse. I've searched in the pitch black of smoke for something I didn't want to find. I felt the pain of not being able to save a life. I've crawled through a building because the heat was so intense. I came out with blistered ears. I've stood in silence to mourn colleagues from other brigades who died in high-rise fires. There are many experiences that I would like to forget, some of which haunt me from time to time. At Grenfell, the fire spread over 19 floors in just 12 minutes and entered 20 flats. Just take a moment to think about that. 19 floors in 12 minutes. Also think about the response and attendance times of firefighting crews which would be needed to fight a fire of that magnitude, let alone the time to set up systems of work to deal with such a fire. So, could this still happen in Leeds? Recent cuts to fire cover in Leeds include the following. Stank Station was closed. Morley, Rawdon, Wetherby, Garforth and Rothwell have all been downgraded to day crewing with an additional 5-minute turnout time. Stanley's second appliance was cut. Moortown's second appliance was cut. Leeds' dedicated aerial appliance was cut. Reductions in minimum crewing levels, plus the downgrading and cuts of other appliances and station closures throughout West Yorkshire and neighbouring brigades affect the resilience here in busy periods. All stations will be affected in the case of large incidents, with crews spread out to provide a skeleton cover across West Yorkshire. Firefighting is a team game. The attendance required at a confirmed high-rise fire is 4 firefighting appliances and an aerial appliance. That's just to start work safely. For a dangerously cladded building, it's 6 firefighting appliances with an aerial. That's just to start work. Where would they come from for your ward, and how long would it take them to get there? Resilience is what we're losing. Less stations, further apart with less appliances, more crews on call from home overnight has obvious consequences. The most distressing times in my career were arriving too late. Firefighters who attended Grenfell have to live with the sights and sounds of people calling for help, knowing that they could not be reached or saved. We know a similar incident could still take place here. 19 floors in 12 minutes. Imagine living in one of those buildings. Would you sleep? We need urgent action. Support this white paper. Support fair funding for the fire service.
Councillor Robinson.
Sorry, Lord Mayor.
Sorry, Councillor
Apologies.
Brooks. Sorry, it's Councillor Brooks. Sorry, Councillor Robinson.
I thought I might not be in order there.
Thank you, Lord Mayor. Yeah, I'd just like to thank my my colleague, Councillor Drinkwater, there for sharing some of his personal experiences. It must have been quite difficult to do. I'm speaking in support of the white paper in the name of Councillor Cooper. Lord Mayor, my colleagues have spoken very eloquently about the difficulties that Leeds residents are facing due to this government's poor handling of the cladding scandal. Residents are in an impossible situation. They have to pay for a waking watch and have high insurance costs. These costs are ongoing and have already set leaseholders back by thousands of pounds. The government's Building Safety Fund, a fund of £1 billion, is already oversubscribed with thousands of applications so far, even though it's only expected to be enough to cover work on around 600 buildings. As well as being covered in unsafe cladding, many buildings have also been found not to comply with crucial building safety measures such as fire breaks. Until all remedial work is completed, most leaseholders are unable to sell. The End Our Cladding Scandal campaign launched a 10-step plan at the end of September. The steps are pretty self-explanatory, but I'd like to draw attention to a couple if I may. Point 4, which is social housing providers must have full and equal access to the fund. As outlined by the Joseph Rowntree Foundation, housing costs are the #1 cause of poverty in the UK in the under 40s. This is a time when genuinely affordable housing is more important than ever, with the as yet unknown economic impacts of COVID especially. Ensuring the long-term viability of affected housing associations should be a priority to guarantee that affordable rents are not affected long-term nationally. And point 9, mental health support must be offered to affected residents. 20% of leaseholders affected by the cladding scandal have considered self-harm or suicide. The shocking level of financial uncertainty would take its toll on anyone, and I pay tribute to the bravery and determination of all cladding campaigners in Leeds and across the country. I'd like to highlight a story shared by one affected local campaigner. My constituent Abby, who at 26 bought her first home with her partner. They want to start a family together. Due to the spiralling costs of remediation work and the unwillingness of Robert Jenrick and this government to act, Abby is facing bankruptcy and may lose her flat. She feels unable to start a family with such financial uncertainty. Abby is a founder of Leeds Cladding Scandal. Cladding groups across the country banded together to launch the national End Our Cladding Scandal campaign. Robert Jenrick is refusing to meet with them to discuss how to move forward with this issue and allow leaseholders to get on with their lives. Lord Mayor, I fully support the 10-step plan as outlined by the End Our Cladding Scandal campaign, and I suggest everyone looks at it. Thank you.
Councillor Robinson.
Are you sure it's in that order, Lord Mayor? Sorry.
It is. It is.
Okay.
Sorry.
No, don't worry. Thank you. I welcome the amendment by Councillor Anderson today, and the news from government that this extra £1 billion. I think there's a crucial role that the LGA can play in this work. What's been very, very clear is that where the LGA has concerns, they're evoked by the leader of council. Where the LGA could take some real action, they're not necessarily steps that are being followed through on. And I share the comments that have been made by Councillor Anderson, and I think there's far more that can be done for residents across Leeds. And similar to the last white paper motion, this is about residents across Leeds. It isn't just certain pockets of Leeds, certain areas of Leeds. There's far more that can be done as a collective and a one city unit. As a final personal note, it's just some thanks to Councillor Drinkwater there. I think it was a very moving speech, and we should recognise the hard work that's done by the fire service across the city and the challenges that they face and the awful after effects that can exist for many of those from the dangers that they see and the horrors that they see every day. Thank you, Lord Mayor.
Councillor Cooper, can I call on you now to sum up?
Yes, thank you, Lord Mayor. And I think I'd really like to take this opportunity to thank Councillor Paul Drinkwater for his real insight into what it feels like to be a firefighter and the experiences that he has had. And I'm sure all members of council would join me in that. So thank you very much for that, Councillor Drinkwater. It was really compelling, and I'd like to pay tribute to you and all your colleagues that work for firefighting in this country. You do a remarkable job. You go forward when others are racing away, and we must never forget that. I think I'd like to move to Councillor Anderson's amendment first of all. And Barry, I thought we were getting on so well, and then you throw an amendment in like that at me, I have to say. But really, it's not about money, and I think that you've taken the white paper motion the wrong way, because it's about policy and it's about responsibility, and not just about asking for more money. You know, money is important, but actually it takes government to take ownership and responsibility of these things, and they're not doing that, which is why I brought this white paper to council today. I think you're talking about Councillor Blake and her work at the LGA. You know, and Councillor Blake did some remarkable work in the years that she was chair of the housing executive board there. and actually she worked with Lord Gary Porter, who I'm sure you know very well, and I'm sure you know Lord Gary Porter's views very well as well. And if anybody's on the council has ever heard Lord Porter speak, by the way, he is a Tory, a Conservative chair of the LGA, former Conservative chair of the LGA. And I've seen him hold a plastic bottle of water on a podium. Barry, I think you were in the audience at the same time. And he promised to stop using plastic bottles when the government took plastic wrapping off of buildings and made people safe. So in the same vein, Barry, I ask you to speak to your own party in those terms. And Councillor Blake will continue to do the remarkable work that she does at the LGAs. I'm sure you're aware of that. Councillor Harrand, I think that your tone was really mild, and I thank you for that. But I'll take no lessons in how to speak to the Conservatives after the last debate that we've just had in this council chamber. Thank you very much. Councillor Bentley, thanks for your support.
Councillor Cooper.
Yes, and your amendment. But we do have some sympathy with it, but we want to focus on all the asks of the cladding support and not just on one. So that's why we're not supporting your amendment today. But thanks everybody for your contributions, and I urge you to support the white paper.
Thank you. I now call on the whips to vote on behalf of their groups. Can I first call on the amendment of Councillor Bentley? Councillor Dawson, are you for, against, or abstain?
The Labour Group are against, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
The Conservative group abstain, my Lord Mayor.
Councillor Campbell, are you for, against, or abstain?
For, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group, we abstain.
Councillor Field, are you for, against, or abstain?
Abstain, Lord Mayor.
And Councillor Blackburn, are you for, against, or abstain?
For, Lord Mayor.
Sorry, that's been lost. I'll go on the second amendment in the name of Councillor Barry Anderson. Councillor Dawson, are you for, against, or abstain?
The Labour Group are against, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
Thank you, my Lord Mayor. The Conservative group are in favour of the amendment.
Councillor Campbell, are you for, against, or abstain?
We're against, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group, we're for. Thank you.
Councillor Field, are you for, against, or abstain?
We're against, Lord Mayor.
Councillor Anne Blackburn, are you for, against, or abstain?
The Greens are against, Lord Mayor.
Thank you. That's also been lost. Now we go for the vote on the motion in the name of Councillor Cooper. Councillor Dawson, are you for, against, or abstain?
The Labour Group are for, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
Conservative group are against, my Lord Mayor.
Councillor Campbell, are you for, against, or abstain?
For, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group, we're for.
Councillor Field, are you for, against, or abstain?
We're for, Lord Mayor.
And Councillor Blackburn, are you for, against, or abstain?
The Greens are for, Lord Mayor.
Thank you. That has been carried. Thank you. We'll now move on to the third white paper in the name of Councillor Chapman. Councillor Chapman.
Thank you, Lord Mayor. I'm sure all council members welcomed the news over the weekend of yet another government U-turn, this time with the announcement that they will now be making additional funding available over the next 12 months to support the provision of free school meals in holidays for children from poorer families. Whilst this is good news and provides some level of certainty over a longer period than previous funding schemes, it isn't a permanent solution to the problem of holiday hunger. Over the last few months, I have seen significant growth in food bank usage within my ward. This is a ward that isn't considered to be a deprived area, and yet we have seen a sustained increase in demand of at least 250% during the COVID pandemic. And I'm sure we have not yet seen the true extent of local need, and I fully expect further growth in demand. I'm also sure that my ward isn't unusual in seeing this growth in food bank usage. With the UK economy forecast to shrink by 7.6% and unemployment to rise from 4.5% to 7.1% in the coming year as a result of both COVID and the likely impact of a no-deal Brexit, we must take action to ensure that children are properly and fairly supported. As Liberal Democrats, we are proud to have implemented the extension of free school meals eligibility to more children across the UK. However, we believe this now needs to go further, and that the government should extend the eligibility for free school meals to every pupil whose parents or guardians are in receipt of universal credit. They should provide food vouchers for every one of those pupils in every school, holiday, and during any future lockdown period. The government should also extend eligibility for free school meals to pupils from low-income families. So many children living in poverty still miss out on free school meals because the earnings threshold for eligibility is set too low. As a council, we also need to look closer to home. With over 28,500 children across the city already eligible for free school meals, and with that number likely to grow, we must ensure that this latest and any future holiday hunger funding is distributed equitably to all those that need it, when they need it. It is a travesty for any child to go hungry on any day. Hunger doesn't know where a child lives. However, this year, only 10 out of the 33 Leeds wards have received a share of the Healthy Holidays Fund. If this latest funding is to be transferred to local councils as suggested, then this administration needs to recognise and take note of the learnings from this year's lockdown and ensure an equitable distribution of funds based on need and not geography. No child should go hungry in this city nor in this country. I move the white paper in my name, Lord Mayor.
Councillor Pryor,
I second and reserve the right to speak.
Councillor Stevenson.
Thank you, Lord Mayor. I generally welcome Councillor Chapman's motion as drafted last week and equally welcome the government's response to it this week. I suspect this is one of those topics that musters cross-party support on the principle whilst highlighting slightly different opinions on the mode of implementation. We all agree on the outcome, but as always differ on how we get to it. Knowing the government has rightly committed more funding to councils for school holiday programmes, I wanted to move this amendment to bolster the motion and better reflect the work done by this council and the government to support vulnerable families throughout COVID-19. Leeds was the government pilot for the Healthy Holidays programme a few years ago, and I'm pleased that this has continued to receive central government funding this year, nearly £500,000 in the first half of this year. It's also important to provide context to this debate, which has been somewhat unseemly in recent weeks. Nearly a quarter of all those eligible for free school meals in Leeds don't actually claim their entitlement in school. Instead, those children are sent to school with a packed lunch at the parents' cost. As and when life begins to get back to some sort of normality, I would encourage the council to look at why families who qualify for free school meals on account of their low income choose not to claim that free school meal in school and what we can do to increase uptake. In my view, the most welcome action by government so far has been the £9 billion invested in the welfare state, meaning those on universal credit and tax credits have received since April over £1,100 a year more in benefit payments to account for incremental costs during the lockdown. The further £400 million announced by government for the winter period is the right response. It keeps support local and allows for targeted measures to be taken by local authorities. This highlights that support is best provided either through local councils or direct through the welfare state. As the council now determines how it will choose to distribute this funding from government, I would urge the administration to steer away from the one-off food voucher. Those who support one-off food vouchers fail to recognise the reality for the poorest households in how they buy food and goods. A food voucher that can only be spent in a chain supermarket is no use to a family that buys fresh food cheaper at a market or a local store. And those who champion vouchers who also ignore warnings from school leaders and staff who are already under pressure, having to administer the vouchers as extra burden to schools during a difficult period. In fact, the head teacher of Brigshaw High School, my old school, in the Kippax and Methley ward, raised this as a specific concern regarding free school meals over the summer. She said, quote, "My staff have had to get up early and log on to Enderud at 6 a.m. and equally stay up till 10 p.m. to be able to access vouchers for Brigshaw families in need. Clearly not acceptable nor sustainable." I agree with this secondary head teacher. It's clearly not acceptable or sustainable way to address the issue. I'm hopeful that all parties will support this amendment as it builds on sentiments in Councillor Chapman's motions and welcome the huge work done by school staff and teachers throughout lockdown. Thank you, Lord Mayor.
Councillor Richards, to second.
Sorry, I'm just about ready. Yeah, thank you, Lord Mayor. I speak in support of the amendment to the White Paper on the provision of free school meals by Councillor Ryan Stevenson. I speak not only as a ward councillor, but as an existing teacher of 35 years in the Leeds education system. The amendment, whilst agreeing that the support of those students in most financial need is unquestionable, the manner in which this can best be achieved is the point of discussion. The White Paper stipulates that free school meals should be available during lockdown and during school holidays. It has no endpoint nor financial ceiling, nor does it suggest a mechanism for achieving this goal. Circumstance has overtaken the proposer of the paper. This lockdown means no automatic closing of educational establishments and continuation of free school meals therein. Governments in this country and across the world have recognised the long-term damage to the more hard-pressed sectors of society, which would stem from further exclusion from education. And the heroic efforts of school staff and the support of parents is keeping schools open, for which all councillors are extremely grateful. Furthermore, the scheme, which will provide support with food and bills and an activities programme up until the summer and Christmas of 21 holidays, shows that this government does listen and take action not only in addressing potential food poverty, but the wider areas of deprivation. Increasing Healthy Start payments will support more families, and the £170 million to be sent through local government will do likewise. The amendment to the White Paper outlines the support which has already been made and will increase to those families in need. There are specific elements built into any calculation of need for the support of children and by definition provision of food. Extending the COVID additional payments will ensure that money is best targeted to where it's most needed. So instead of sneering at this as a U-turn, it actually reflects the ability to listen and respond to need. The groundswell of public eagerness to provide additional support also taps into the desire for the public, including businesses, to be an actual physical part of the support network. Marcus Rashford is the high-profile face of this need and is in a position to talk personally with the Prime Minister. But every resident who came to the food and gift donation point in my ward last week felt affirmed that they were doing their part in helping others. Contributing to the fabric of your community is not negative behaviour, it's a way of showing the community is supporting all its residents. The Butler Education Act of 44 made it a duty of local education authorities to provide school meals and milk. There was a recognition that children would learn better if nourished better. Milk is still free to all children under the age of 5 and to those in receipt of free school meals and is subsidised for all children. All children in reception are entitled to free school meals, as are all children of universal credit applicants. Contrary to public belief, there is no desire to return to Dickensian times. The aim is to enable everyone to achieve their best potential in life, and a healthy life is the right of everyone. However, this amendment, whilst not disagreeing with the aim of the White Paper, seeks to recognise it can be achieved in a more effective manner rather than simply asking for more in a vague and untargeted way. My Lord Mayor, I commend this White Paper and its amendment to you.
Councillor Pryor.
Thank you, Lord Mayor. I'm really happy to second this White Paper. And we must be clear that while this latest U-turn from the government is welcome, it does just serve to highlight how little of a plan the government has to navigate the COVID crisis. The government must acknowledge that the damage that a decade of cuts has done. Why does one of the wealthiest countries in the world have such shocking figures of child poverty, meaning that we need emergency measures like this to ensure that children are fed? And I must take issue with parts of Councillor Stevenson's amendment. It states, and I quote, "Now schools are fully operational," which completely overlooks the fact that schools and school staff have been working tirelessly throughout the entire COVID crisis, and also seems to forget that schools are being asked to continue to remain open through the government's second lockdown, while bubbles still collapse. The school environment is very different at the moment. And then towards the end of Councillor Stevenson's amendment, he would like us to support his comment that, and I quote again, "This council supports the majority of teachers." Well, no, I'm sorry, but we support all teachers in their work, and we're not going to be drawn into party political games around some teachers we support and some teachers we don't. Schools highlighting complicated systems the government insists on does not mean that those schools support the government in stopping children being fed over the holidays. And Councillor Stevenson should be careful about how he represents the views of school staff. So in the coming days, we are going to be looking at the detail of exactly what the government is offering Leeds, but we do need a guarantee that children in Leeds will receive what is needed. Not just a list of national funding given without context. This is not an issue that is going to go away. And as Councillor Chapman pointed out, more and more families will be falling into poverty, and this need is only increasing. Over half term, it was left to the generosity of our own community and squeezing already strict council budgets to do the right thing. The response we saw across the city was incredible, and I do really want to thank and pay tribute to all those who stepped up to ensure that Leeds did the right thing. And as a country, we must thank Marcus Rashford, who refused to quit, refused to pipe down, and used his profile to shame the government, not just once, but twice. And then our own Tory MPs and councillors, usually so vocal when it comes to education matters, had been noticeably quiet on this. I mean, Councillor Stevenson told us there was cross-party support on the principle of this motion, but we have seen a slew of articles from Alex Shelbrook, from Stuart Andrew, from Andrea Jenkins, explaining why they were against providing meals for children. So have those MPs changed their minds since the government U-turn, or do they still believe what they said before? And that's something I'm not sure we'll ever really get an answer on. Thank you, Lord Mayor.
Councillor Forsyth.
Thank you, Lord Mayor. I'd first like to recognise and say thank you for the wonderful work of those who've run the Healthy Holidays projects for our less well-off children in Leeds. A big thank you and also recognition is also due to the school meal services across our city who provide daily nourishment for our children during term time. And in also thanking all school and college staff, let's think about schools and our children and young people for a minute. Nationally, an average of 9 children in each class of 30 are poor. Just to be clear, poverty is a significant factor in a young person's ability to make the most of the educational opportunities that are offered. As we know, the COVID pandemic has provided very significant challenges for schools to continue to work safely. And it's clear that schools and academies are not fully operational, as has already been talked of by Councillor Pryor. How could they be? The attendance figures have dropped dramatically since September due to schools sending children home to self-isolate. And the way that schools are currently having to be managed safely is nothing like business as usual. Ask any teacher if you can find one that's not overworked and already feeling quite exhausted. Although there have been so many occasions in recent years when I felt angry and ashamed of how our country is being run, I was still surprised as well as appalled at how this government has handled the COVID pandemic. But a new low was reached in October when elected MPs voted not to provide children with free school meals over half term. This was a vote for child poverty. It would have cost £20 million to provide free school meals over half term, a small sum compared with £1 billion spent on questionable COVID contracts. That same half-term week, the government announced that they were spending £185 million on management consultants. It was very clear, yet again, where the government's priorities lie. So although I'm now pleased that they have done and extended a free school meal provision into the holidays and lockdowns, I cannot give the government credit or praise for this further U-turn. We know what needs to be done in Leeds to lift all children out of poverty, to bring forward the time when no children in any classrooms in Leeds are poor. Extending the Healthy Holidays scheme across the whole city would be a start. I add to the urgent call to the government for the funding we so badly need to reverse the years of austerity and to address the further challenges that this coronavirus pandemic has brought. Thank you, Lord Mayor.
Councillor Orley.
Thank you, Lord Mayor. I'd first of all like to start by reaffirming both Councillor Price and Councillor Forsyth's comment on thanking all those who've worked in our communities tirelessly to keep families fed during the pandemic. As Councillor Chapman has already said, on the face of it, we should perhaps be grateful for the government's U-turn on the issue. However, the decision has come far too late. Families have been under stress, which was needless, and this lateness in making the decision has caused councils and charities all over the country to hurriedly expend scarce resources, time and money on vital care for needy families, only for the government to then step in. This U-turn was only the result of Marcus Rashford's intervention, who through his personal experience has finally convinced government of what most of us know to be true, that hunger is a real issue in our society today. Hunger affects children's development. As Councillor Pryor mentioned, it affects learning. It affects health, placing extra burden on the NHS. But most of all, hunger is not some throwaway word to describe a mere situation that most, if not all of us here, do not have to experience. Hunger hurts. Hunger is pain. Hunger is debilitating. And it is utterly shameful that the UK, a wealthy first world country, has a food poverty problem today. It is shameful that it needs to make emergency provision to feed its children. It is shameful that we depend on food banks more than ever. It is shameful that the government has dug its heels in until embarrassed by such an influential celebrity to address the problem. So, as I've already said, I welcome the government U-turn, but this problem is far from solved. And I care not for statistics, for figures on spending, news of initiatives, nor for that matter comments such as I've heard on irresponsible parents misusing resources. Rather, I care that we recognise the genuine needs in our society, that we support families, we eradicate poverty, we solve this shameful situation once and for all. I agree with Councillor Stevenson. We do need to understand more of the reasons for children or families not taking up their free school meals. But coming to another of Councillor Stevenson's points, I would further add that if vouchers are not the solution to the problem, it is for the government to find workable solutions and support us in implementing them. I am grateful to Councillor Chapman for bringing this white paper. I implore anybody who can for a moment imagine the pain of hunger or the feeling of shame of not being able to feed their families to support it. Thank you, Lord Mayor.
Councillor Lamb.
Thank you, Lord Mayor. 30 years ago, I was a free school meals child at school. I rarely had my free school meal. Twice in my 5 years in secondary school, I took it up. I was one of those that didn't take it. Why? Two reasons. One, the school meals at my school were awful. And two, in those days, you had a little card and everybody knew you were a free school meals child. And I didn't want to wave it in front of my class. So I went and played football with my mates instead. It may seem hard to see now, and some of you will chuckle when I say it, I'm sure. But I do know what it's like to feel hungry. And it's not a feeling that ever leaves you, ever. 6 years ago, I became a provider of school meals through my business. My memory of free school meals was one of my driving ambitions for doing that. When I took over the school I was at, 50% of those eligible for free school meals didn't take it up. It was my personal mission to make that zero, to make sure every child took up their free school meal. We put masses of effort in. We got it up to 85%, and still it was heartbreaking every day that dozens of children weren't having the nutritious hot meal that they were entitled to have. Lord Mayor, nobody wants children to go hungry. Nobody. It's been hard as a Conservative watching the debate over the last few weeks, and I'm pleased that the government finally made the right decision. If they hadn't have, we would have supported this white paper today anyway. We'd have probably still made an amendment, but we would have been voting with you. Lord Mayor, this is a difficult issue. The reasons for child poverty have been exacerbated by the COVID pandemic, but that is not the cause. They existed 30 years ago. They existed 50 years ago. They existed under the last Labour government. It is a complicated, complex issue. There are many, many things that are needed to be done to tackle it. What's been announced over the weekend, all of the good things that are referenced in Councillor Stevenson's white paper are sticking plasters, to be frank, and there is a lot more work that needs to be done to tackle this issue, but tackle it we must. Lord Mayor, I'd rather have a government that listens and makes a U-turn, changes its mind, whatever you like to call it, but ultimately does the right thing. We've seen in previous debates what happens when leaders stubbornly stick to their position and refuse to change course when all the evidence tells them that they should. Lord Mayor, all that Councillor Stevenson's amendment does is recognise that the government has listened and responded. It seeks to follow what Mr. Rashford has suggested politicians do. And finally, I would like to thank teachers and all those working in schools to ensure that they can stay open. That, Lord Mayor, is what, if Labour are true to form, they will be voting against today. I hope they'll do the right thing and support Councillor Stevenson's amendment. Thank you, Lord Mayor.
Councillor Marshall Takun.
Thank you, my Lord Mayor, and good evening, Council. I am absolutely delighted to speak in support of this white paper, as I think it's an absolute disgrace that the government turned their backs on millions of vulnerable children across the country until they were shamed into performing yet another humiliating U-turn, which lots of you have already mentioned. At a time when job security is a thing of the past and unemployment rates are escalating, it beggars relief that the Tory government decided children should be the ones to pay the price. In Leeds, we have seen the numbers of children eligible for free school meals increase at an alarming rate. Yes, Councillor Lamb, you don't need to shake your head. In fact, by August this year, we had reached what was the pre-COVID predicted figure for January 2021, over 28,500 children. And by half term, that increased by another 1,000 children. When you combine this with the increasing number of families who are struggling to make ends meet, who are once again in fear of losing their jobs, who have already done, and those who have already done so, the picture becomes even bleaker. What I find astonishing in recent analysis by Policy in Practice that showed parents would need to earn more, almost 3 times more than it would cost the government to feed their children over the school holidays. This means that just to cover the Christmas holidays, parents will have to find an additional £81 per child. This equates to an additional £117 million to cover all families in receipt of free school meals, compared to the £43 million it would cost the government. What we saw over the weekend was the latest in a series of climb downs that the government have been forced into. Over half-term in Leeds, we saw countless businesses and members of the public coming together to ensure our vulnerable children in this city do not go hungry. It was a truly Herculean effort and something that made me incredibly proud to belong to Leeds. And from the bottom of my heart, I want to say thank you to every single person and business who showed kindness to our vulnerable children. Finally, my Lord Mayor, the simple fact remains that it should not have been necessary in the first place. If the Conservative government had only accepted the Labour Party's motion that called for the extension of the free school meals, instead of whipping their MPs to vote against it, they would have been able to avoid the embarrassing phone call that the Prime Minister has had to make to a 23-year-old footballer. Councillor Stevenson stated that the government are now committing to Marcus Rashford's sentiments. Please, his intervention are not sentiments. I will tell you what they are, Councillor Stevenson. It's from a young boy who has had the time to think about the things he could never forget. and also teach Conservative MPs and others what compassion truly means. Thank you very much, my Lord Mayor.
Thank you. Councillor Lennox.
Thank you, Lord Mayor. Thanks for the opportunity to speak on this white paper. I want to focus on the children and young people that this issue is actually affecting. They are some of our most disadvantaged young people for whom the assurance of a hot meal at school is vital. The Education Policy Institute released research over this summer that found that the gap between the advantaged and disadvantaged pupils had widened for the first time in 12 years, even before COVID hit. They've placed the blame at the door of rising persistent poverty, and I think we can all work out where to lay the blame for that. There is a very real concern that with the gap that was already widening, what has been the impact of COVID on these children and how can we address it? Now, the DfE appear to be in denial. They issued a statement in response to that research that said, while the attainment gap had narrowed since 2011, many have had their education disrupted by coronavirus and we cannot let these children lose out. The Tory government then followed this up by voting in Parliament for those children to lose out. The fact is that many of them were already losing out due to a decade of austerity measures, which have been an ideological choice and not a financial necessity, that have pushed more and more children and families into poverty. COVID-19 has had a devastating impact on so many different aspects of our lives, but it is not to blame for everything. And there were stark and desperate inequalities present in communities before it arrived. A £1 billion COVID catch-up package was announced, with schools given money to be spent on one-to-one group tuition or support for pupils who needed it. However, head teachers have pointed out that not all of the money is new because pre-existing funding, which was meant to help close the gap as people's move from primary to secondary schools, has been scrapped. The Institute for Fiscal Studies has highlighted that the £650 million for all pupils equates to just £80 per pupil, and I'm not sure how far that will actually go when we consider the wide range of inequalities that schools now have to try and tackle on top of all the other pressures of this year. Schools have also raised concerns that the very children who need this additional support and personalised help are the ones least likely or least able to engage with it. What I find most upsetting is that these children are the ones who consistently miss out. They are always at the bottom of the list, and when it comes to the government. However, I know that as they do year round, schools and communities, certainly in my ward, Crossgates and Winmore and across the country, have put the government to shame in the way that they've responded to make sure that these children are not left behind by these callous policy decisions. Those children who have the least should be put first and not be ignored until a footballer embarrasses the government into a climb down.
Thank you. Can I now call on Councillor Chapman to sum up?
Thank you, Lord Mayor. And thank you to everybody that's spoken during this part of the debate. I think everybody contributed something there. During the meeting, we've obviously had a lot of references to holiday hunger and child poverty, and that's rightly so. This, at the end of the day, it's about children going hungry, and any child that is hungry, it's wrong. No child should ever be to blame for being hungry, and they shouldn't be allowed to go hungry. It's a travesty in this day and age that it's still happening. Councillor Lamb, thank you for your words. I'm glad you don't mind U-turns because you have a lot of practice at them these days, which is good for you. I think what I would say to what you said is this is not a permanent solution. This covers funding for the next 12 months. After that, what's going to happen? Is the government going to use this time to find a permanent solution? Councillor Richards, you said there was no end point in my motion. That's because until we have resolved the issue of child hunger and child poverty, there isn't an end point. Yeah, there is no way you could actually put one in there. I mean, I could say today that I want this government to have resolved this issue in 12 months' time. I have no faith that this government would do that. We cannot continue to let our children go hungry. We have to treat them equitably. No child should be fed at the expense of another child. No child is more deserving than another child. And there's very little else I can say than, as I say, to thank everybody for their contribution. Lord Mayor, I move the white paper motion.
Thank you. I'll now again call on the whips to vote on the behalf of their groups. We're going to vote on the amendment of Councillor Stevenson. Councillor Dawson, are you for, against, or abstain?
The Labour Group are against, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
Thank you, Lord Mayor. I am in favour.
Councillor Campbell, are you for, against, or abstain?
Against, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group, we abstain.
Councillor Field, are you for, against, or abstain?
We abstain, Lord Mayor.
And Councillor Ann Blackburn, are you for, or against, or abstain?
Against, Lord Mayor.
Thank you. That's been lost. I'll now call for the vote in the motion of Councillor Chapman. Councillor Dawson, are you for, against, or abstain?
The Labour Group vote for, Lord Mayor.
Councillor Cohen, are you for, against, or abstain?
Conservative group vote for, Lord Mayor.
Councillor Campbell, are you for, against, or abstain?
Liberal Democrat vote for, Lord Mayor.
Councillor Hutchinson, are you for, against, or abstain?
Thank you, my Lord Mayor. The MBI group, we are for. Thank you.
Councillor Field, are you for, against, or abstain?
We are for, Lord Mayor.
And Councillor Ann Blackburn, are you for, against, or abstain?
For, Lord Mayor.
Thank you. That vote has been carried. Thank you. We'll now go to the last item, not for debate, white paper. Councillor Blake.
Thank you, Lord Mayor. It gives me enormous pleasure to move this white paper in the terms of the notice. As we've said, it's a huge disappointment that more of us couldn't have been down there with them, but they've done us proud. I'm delighted to move this white paper motion. Thank you.
Thank you. Councillor Carter.
I'm absolutely delighted to second. Like Judith, a great pity more of us couldn't have been down there to see them triumph and get back on track to being the #1 rugby league side in the country.
Thank you. Councillor Owley.
Thank you, Lord Mayor. Having intimate experience of the sport of rugby league, I fully appreciate this fantastic achievement and what it does for the city, and therefore I obviously offer my full support.
Councillor Finnegan.
Delighted to support, Lord Mayor. Thank you.
Councillor McCormack.
Thank you, Lord Mayor. On behalf of Garth Swillington Independents, we're delighted to formally support this white paper. Thank you.
Councillor Blackburn, David Blackburn.
On behalf of my group and as a former junior with Leeds Rugby, I am delighted to support the motion.
I'll now go for a vote. If anyone against or abstain, please say so, but I'll just take a silence for all in favour. Thank you. That's being carried. And this brings us to the end of our meeting. Can I take the opportunity to thank you all for your patience and support today? Thank you all. I was going to say safe journey, but it's only 3 of us need to